session, of which we will start with the third segment now. We've looked at the intersection of gender and healthcare, gender and education, and the next segment, as you can see, is titled Gender Policy and the Intersection of Skills and Employment. To facilitate this session, we have Ms. Amrita Girish with us, a PhD scholar in the entrepreneurship field at the Indian Institute of Management, Bengaluru. Before transitioning to academia, she was a public policy professional with 5 years of experience in the social sector, having worked at both the district and state levels. She has served as an executive manager at the Karnataka Skill Development Corporation, and she holds a master's in development studies. She earned her bachelor's degree in commerce from Christ University. She is also an alumna of IIMB through the Mahatma Gandhi National Fellowship, a 2-year public policy and management program from the Ministry of Skill Development and Entrepreneurship, Government of India. Please join me in welcoming Ms. Amrita to the speaking area, please. I'd also like to introduce the moderator for this session. She is Dr. O. Grace. She holds a PhD and an MPhil from the Jawaharlal Nehru University and is pursuing her postdoc at the Institute of Social and Economic Change, Bengaluru. Professionally, she is an assistant professor at the Department of Public Policy, Bengaluru, where she teaches public policy, public administration, and other subjects. Please put your hands together for Dr. Grace. I now hand over the stage to Ms. Amrita and Dr. Grace.
Thank you. Good afternoon, everybody. The morning sessions were a tough act to follow. I'll keep it brief because I'm told that one, the sessions have spilled over, and other is you have some exciting exercises ahead. So, all right. Firstly, I would like to thank MAHE and the public policy team. It's really a huge privilege to be part of this discussion alongside such accomplished professionals, women, and of course, future policy leaders and practitioners. The depth and breadth of experience in this room is truly humbling. It's also invigorating. So I will borrow the caveat that ma'am was saying earlier, that whatever I'm saying is informed from a little bit of my practice, because I'm not a public policy scholar. I'm a scholar in the entrepreneurship area, but my background work experience comes from public policy. I'll start with this quote from the International Labour Organization. Each country's prosperity depends on how many of its people are in work and how productive they are, which in turn rests on the skills they have and how effectively those skills are used. And we will be looking at what's happening in India with regard to how many people are in skill, whether their skill set are being really used, especially when we talk about all the genders. Why is there so much buzz around skilling? Why is the word of the day? I'll just, in quick 4 statistics. So you must have all heard about the demographic dividend. So by 2030, our demographic dividend, the youngest population, it's going to peak. And we have a very short window of opportunity to capitalize on for our socioeconomic progress. Then secondly, I take from a 2022 study, but then I'm sure the numbers will be much higher now, considering all the recent developments in AI and automation, that about 69% of jobs in India are at the threat of being replaced by automation. Another thing is regarding climate change, which presents as a threat and also an opportunity for skilling and jobs. There are going to be 35 million green jobs that are to be created by 2047. And finally, I was reading recently that even Harvard graduates are finding it hard in placements because it's now the world is moving towards skill-based recruitment over education-based or qualification-based recruitment. And to just give you a perspective from the UN SDGs, it gives a very wholesome framework for us that looks at the intersection of gender, skills, employment, and entrepreneurship. I start with The second SDG, Zero Hunger, where there is an emphasis on women, indigenous knowledge, indigenous communities for agriculture and food security. Then we move on to the most important one, the quality of education, which specifically talks about the TVET ecosystem, that is the technical vocational education and training ecosystem, where equality, eliminating gender disparity is explicitly mentioned. Then we move to gender equality, which talks about recognizing and valuing unpaid care and domestic work. We move to SDG 8 that talks about decent work and economic growth. Then there is reduced inequalities where it addresses social, economic and political inclusion. And then the previous speakers, especially Manjula ma'am in the morning, talked about how access to safe, affordable, accessible transport system is very important, and that's where SDG 11 comes in. And then finally, this is something I've been hearing all day, and it's also very important, is the partnership, the goals, the SDG number 17. It's about bringing institutions together, bringing economies together, because the problem of India, if you look at something like climate change, is not just the problem of one economy, it's worldwide, right? This you will get from your PLFS study, but I just wanted to, before I talk about skills and women, I just wanted to tell you that you all know the labor force participation is abysmally low for women vis-a-vis men. And then the three below there, they refer to the informalization of our structure and challenges in formalizing the structure. If female as well as male, about 57 to 58% do not have a job contract. They don't have social security benefits, then they don't have paid leave. So this sets a context for us. Now here's a question to you. What can you tell me about this image? Anyone, you can volunteer. Anything that brings to your mind, anything about this image? What do you think is the context? What's happening here? There's an electrician and training program on the left and a beauty training, therapist training program on the right. Anything else that stands out for you? Yeah, that's very clear here. Yeah, this is not a stock image. This was from an initiative that I was monitoring, and it was already in place by the time I was at Karnataka Skill Development Corporation. And today I do not speak for the Karnataka Skill Development Corporation. It's just from my experience that I'm talking about. So as you can see, herein starts the gender divide, that the government has already decided that women will undergo beauty parlor training and men will undergo electrician training. And there has been no consultation with the community on what they want to do. This is similar. This was a very well-intentioned program. This is similar to what ma'am was mentioning on healthcare on wheels. This was skills on wheels. The buses were equipped with equipment, and trainers go to remote places in Karnataka to enhance access. But at the same time, they're creating a new divide. And this is not just affecting women, right? There's missed opportunities for all genders here. When I say farmer, I'm pretty sure you will think of a male in your head, most likely. Many of you might. But a large, huge section of our farmhand are female. We never think of that. When I say a nurse, you're more likely to think of a woman. When I say teacher, in caregiving roles, you're more likely to think of a woman. And this is creating divides, right? So if let's say there is a male who wants to be a nurse, then he will be looked down in the society, more likely, especially if he comes from an ecosystem that is not very well informed. And yesterday I just did a check on Solar Technician India. And look at all the images there. It's all men. And however, there are a lot of solar technician trainings that are being done by CSR houses. There's government doing a lot of it. But I'm just talking about how language and also the imagery we use, how this starts that divide, even before we have come to employment and skills. I know I have to mention Mrs. Uma Mahadevan here, and I saw from your Insta page that she has visited DPP as well, and some of you are very close associates of her. And she was taking a meeting when she was heading the Department of Skills, and she has always been an advocate of gender inclusive language. And she would say chairperson, don't put man everywhere, like, and that is very important. If it comes from the head of the organization, the people at the district level, they will listen, they will change their language. And then slowly, when the head of this organization starts asking questions like how many women have been trained, how many persons with disability have been trained, then those statistics starts creeping into your reports. Otherwise, they will go unnoticed. Most of this has already been covered by ma'am in the presentation in the morning on the leakages from skills, or this is the context of skills, but you can apply to education as well, like she talked about the PhD scholars in the morning. So when it comes to skill acquisition, there is, like I said, an aspiration divide starts, where whether are women really being, this is a fundamental question we have in philosophy, but are women being agentic when they are themselves choosing a beauty therapist role, or has it the society conditioned them so much that they themselves would choose it, right? And then there's the question of access. Of course, we've all talked about how all the brilliant institutions in Karnataka is centered in South, especially Bangalore, and there is huge regional imbalance in the state of Karnataka, and I'm taking the example of Karnataka because that is my context. And the quality of training and quality of skilling as well, whether you take infrastructure or you take the quality of instruction, that is also a big challenge. Then we move on to placements. Now, in placements, this happens, that there is a skills and job mismatch. So we were talking about this earlier. You are highly qualified for the job, but reports are telling us that only 50% of even engineering graduates can be employed. What about the rest? So there is a skill mismatch that also happens. India doesn't have a jobs problem. There are plenty of jobs. There is this aspiration mismatch, and there is a wages mismatch, huge mismatch for the kind of work that people want to do and the kind of opportunities that are available out. And then this has also been addressed very extensively in the presentations in the morning about retention. Okay, now government, after the training, government tracks for 3 months whether that person is employed or not. What about after 3 months, right? We do not have longitudinal studies that look at the retention, the return of women who have been away from workforce for a long time, and the advancement of women, the rise of women in career, in leadership roles as well. So there is lack of support systems, there is hostile work culture, whether there is harassment, workplace harassment or not. These things keep women away from workforce. And this, when there has been such a gap, that erodes women's confidence. And we've also talked in the morning extensively about the motherhood penalty, right, that the women have to bear. So when this happens, you must have heard of a lot of women, I've come across a lot of women who then prefer moving into the informal sector if they are a little lower rung of the society, or they think entrepreneurship will offer them pathways. But there as well, I've heard of stories of discrimination. The woman CEO picks up the phone, the vendor says, "Can I talk to your husband?" when she is the CEO. And there is a research differential. It's much harder, studies have proven that it's much harder for women to raise capital and be taken seriously in boardrooms. There is also the work-life myth that happens in entrepreneurship. Your work and life, your leisure, whatever we talked about, starts blurring. You're 24/7 entrepreneur. You're also handling multiple jobs. And so this was an interesting statistic. So when you look at statistics, you'll come across a lot of these paradoxes, and then you can start questioning and looking further into them. That many women are going into informal jobs. That's there. They're starting up businesses, but these businesses are not sustaining as much as those run by the men. So clearly there is something happening between that process of starting up and being established. So across all these factors, there are some common factors. The previous speakers have addressed some of them, so I will not go much into detail. But social networks, right? Now, when we talk about social network as a capital, women possess much lower social network, especially if they are in a rural household. Then, just to give you a comparison, an average woman in the US will know 8 people, let's say. In India, it's 1 point something. And we often talk about the discriminated, the disadvantaged. But here, in this case, the disadvantage can come from the so-called upper class society as well, because they have more rigid caste barriers. So that woman will have 0.7% less than somebody who is more disadvantaged, let's say economically or socially also. Then intersectionality, I will not talk about, ma'am has already spoken about it. Safety, affordability of trainings, quality trainings, that is pretty much self-explanatory. And all these structural rigidities that the previous speakers have already alluded to, whether it is the social cultural barriers or the economic barriers. I'll give you just a quick brief on what the skill development and entrepreneurship and livelihood department overlooks. There is the national livelihood missions, the urban livelihood and the rural livelihood missions. There is the government tool room and training center, which does long-term trainings. There is the Commissionerate of Industrial Training and Employment. You must have all heard of the industrial training institutes like ITIs. Then there is the Center for Entrepreneurship Development of Karnataka, which does short-term entrepreneurial trainings. Then there is KGTTI, Karnataka German Technical Training Institute, which also does long-term trainings. They have 8 centers of excellence across the state. And then there is Karnataka Skill Development Corporation, of which I was a part. They run CMKKY and PMKVY short-term skilling, NSQF skilling programs. In the last year's budget, the budget stipulated that a state skill policy must be introduced, the first of its kind in Karnataka. And this policy is currently being drafted with the blessing of the team that is currently looking into this. I have put some points for you. So some of the things that this policy, it's still in draft, like I said, it's still being made. Some of the things that it's trying to look at is infrastructure from tools to toilets. So can you even imagine that there are ITIs where there are no toilets for women? And then we're talking about women in STEM and women in technical education. Some of the ITIs are so far away, situated from the center of the towns and the villages, that women don't feel safe. There are no buses. I've heard stories from the ground about these things. We have already talked about gender-sensitive course content. Ma'am covered it in education. There is also discussions around fee waivers for ITIs to encourage further enrollment of women, because there is only 10% women. So government thought that maybe the co-education in ITIs may not work. They introduced women-only ITIs, but now those women-only ITIs, you see men in those ITIs because they are there's under-enrollment in these ITIs. Then digital and financial literacy. So I was just looking at this Global Entrepreneurship Monitor Women's Entrepreneurship Report that said women don't think that digital skills are important. And we are living in this age where everything is digitalized, and we still live in an age where more women than men think that digital skills are not important. So that's something that the policy should address. There's also trainer sensitization about being aware and well-equipped to address needs effectively and empathetically. There are return to work training programs that you must have heard of. There's an institution called Karnataka Digital Economy Mission that is working with the IT sector and the other technology sectors in Karnataka to bridge skill gaps so that more women can return to the workforce and any skill gaps they have can be bridged. Ma'am is an expert in monitoring and evaluation, of course, but we have to also think about beyond gender-informed M&E, gender-sensitive M&E to gender transformative M&E. It's not just looking at disaggregated data and saying, okay, this is it. You have to look at changing the system. You have to look at making systemic changes, right? Yeah, I thought I'll just put up some opportunities for future research, because if you're interested in taking questions up in this sector. So is there really a systemic bias? Why somebody, I think Gautam in the morning was talking about the gender pay you were referring to, right? Yeah, you were referring to the gender pay. So this is interesting 18-minute documentary, Netflix and Vox co-produced on gender pay. Please take a look at that. And there's a lot of questioning around, is it all discrimination? Because we've also talked about the motherhood penalty and other things because of which there is such a huge differential in pay, and also some of the progressive policies that countries like Iceland are doing, where there is mandatory paternity leave. So you have to take that paternity leave, and that man is in the house taking care of the kid. So you can also incentivize, you can also bring some systemic cultural changes. I think that is more relevant for a society like ours. Then there is, there's been a paper, I don't recall the name, but this was an experiment to see whether there is any discrimination that happens based on for people of color, right? So only the names were more ethnic sounding. There were 2 resumes, very identical and everything else. Just the names were, one was more Americanized and one was more indigenous. And the Americanized ones were more likely to get selected, even though everything on the resume was the same. So you can conduct like interesting experiments like this that truly bring out that discrimination factor out. Then skills and employment mapping, this is so important. We do not know where we stand in terms of the skill gaps. What do you even, what do you address if you do not know what you're trying to address? The last nationwide state and occupation specific National Skill Development Corporation survey was in 2012 with projections till 2022. So this is a huge opportunity. Every state, every district wants to do this skill survey. And if you can tie up with the government and say, I'm going to look at just this geography and just this neighborhood and do a skill survey, nothing like it. You can make such a huge difference. Then ma'am has already talked about evaluation studies and how they are very important. So I was just calling up beneficiaries, if I can use that term, of loan recipients, of some women-oriented loan programs. And I was talking to them, and then I realized that they were just taking the loans in the name of the women. The businesses were being run by men. This was just to get that extra interest subsidy that women get. So these things you'll find out only when you talk to the beneficiaries. And we've already covered longitudinal studies. And as much as there is been talk about large-scale data, large-scale surveys, that is very important to address policy issues, that is very important to persuade policymakers at the highest levels. But I also believe in capturing qualitative, that qualitative research can capture the lived experiences of women and gender minorities at various levels of leadership. So I have seniors in public policy area who are doing ethnographic studies, who are doing all kinds of different, very interesting, I'm sure ma'am also has some mentees under her who are doing the same. And then how do you account for unpaid work? And you put a number on it, because there's an economic cost. All this talk is not just about, it's not just to talk about there's a discrimination. It comes as a huge cost to the economy. We started with the ILO saying that there is underutilization of resources that happen, and your human capital is the biggest resource for the country. And if you're leaving out a huge chunk of the population which is not engaging in meaningful work, then, and creating barriers for those who want to, then we are losing out on a lot. So this is not just, this is a socio-economic imperative. And most of you have already talked about this, but I'll just quickly go through them. So when I say holistic solutions, right? So what's happening these days is you have a very shaky foundation and you're trying to build floors on top of it. This is what's happening with skilling. At the healthcare level, at the Anganwadi level, we have not given enough nutrition to the mother and the child. The learning absorption is low in education level, that is showing up. And then when the child has completed graduation and is not employable, you're saying, let's skill the child. Of course, that is not going to work. So you need a very holistic, comprehensive set of solutions. And everyone has talked about this, how different departments need to come together for any policy. And that doesn't happen often. I just want to give an example of, I had worked with a community-based organization. I helped set up a self-help group for trans women in the Shimoga district in Karnataka. And I went in thinking I'm going to skill these women, I'm going to get them into employment. But once you talk to them, you realize from the ground up that they do not have documentation. So how do you even enroll them for a skill training if they don't have proper documentation? Because some of them have changed names and things like that. And this shows up also in the case of migrant labor, right? Your welfare schemes are all tied to one state, and then you have to, then you're talking about mobility to another state. That's not going to work. Then everyone has just addressed the importance of contextualizing knowledge, whether it is at state level, district level, different problems. So that's why research becomes very important, whatever context you look at. Bias, of course, everyone has already talked about it. Your own bias, check your bias, acknowledge it. There are ways to correct it as well. And the whole theme, like Harini ma'am was talking about in the morning of SAMAH, there's a balanced approach. You have to have that idealistic lens of my research is going to impact something, but also come up with pragmatic solutions, you know, like, of course, we need systemic changes, but they don't happen overnight. There are a lot of incremental changes that go into the systemic changes. And so many of the policy, what we do, it's just stopgaps, right, fixing it there and then. But we also need to look at longer term solutions, and that has come out in a lot of presentations today. And as public policy students, you must all follow different pathways. I'm sure not everybody will end up doing a PhD or end up in academia or in a think tank. So, and I'm sure that the motivation for all of you was most likely to bring about some social societal change, and that's why you're here. So you get to decide the extent of immersion, because there are multiple, so I believe in this equifinality that if your goal is societal change, then there are multiple ways to do it. There are multiple levels that you can do it. The extent you get to decide what you want to do. It's not that you can only bring a change if you're a bureaucrat. So I end with that, but then I will just take a second to read these lines from a 16th century Kannada poet. Kelavam ballavarinda kaltu, kelavam shastrangalam kelutam, kelavam malpavarinda kandu, kelavam sugnanadim nodutam, kelavam sajjana sangadindariyal sarvajnanappan naran. Which means, from the knowledgeable you learn, from the scriptures, books, scholars, research, from the doers who are actually on the ground in the community, from your own informed perception, from good company, all knowing becomes the man. I think this sums up everything about knowledge. So I end with that and take questions. Thank you.
Hello. Thank you very much, ma'am. So as you all have heard about whatever she has talked about. I have no specialization, although she talked about the crisis in the AI age in terms of losing jobs, right, by automation, and moved on to so many other issues, including climate, skilling, all sustainable development goals, and to issues related to inclusion, relating to socio-political and economic issues, and also about informal jobs insecurity, right? And she also talked about gender divide in terms of labor, right? So that's one thing, to notice, right? Where we see gender divide from the way government sees it, right? How the state sees it, or perhaps go back to understanding the roots as to where does this gender division of labor originate, right? Then talked about skill development in the government and policy implications regarding the skill policy, which is in the draft stage, right? And of course, the implicit biasness that can be there, and it's also, you also can't deny that to some extent we are all biased, in certain ways. And talked about certain research approaches in conducting these kinds of research, and very crucial issues related to paid and unpaid care, which is very relevant in the urban, economy, and problems faced by the marginalized sections, such as the migrants, in terms of producing documents, which makes it much more difficult to get into the employment sector, right? Thank you so much. We'll open up for questions. Anybody? Any questions?
Hi, I'm Kushi. Really insightful talk. I was thinking a lot about the idea of unpaid work, the idea of, you talked about, how the labor force survey says that women have a much lower labor force participation as compared to men. And this is more just me trying to understand, your thoughts on this. But when we talk about women not being in the labor force, in a way, that's not actually true. Women are in labor. It's just more unaccounted labor. So you talk about care labor, you talk about homework. They are engaged in some level of productive work. So I think I was just wondering, where do you see this as a job? How accurate do you think the data is really accounting for women's economic effort? And in terms of skilling then, what sort of trajectory do you think these women are really following? What sort of skilling can we do for women? Because this is also a large chunk of women, right? Especially say in rural areas where they're engaged in this sort of work. And the fact that even in terms of skilling, a lot of women can't really leave their houses. They are bound to the domestic work that they're engaged in. So when you're saying, oh, we want to uplift women, how do we do that in this sort of a context? And so that's my question, yeah.
That's exactly the challenge, right? We are not accounting for that labor, and that is missing out in the larger statistics. And to talk about how do you train these women, first of all, you find out whether they want to be trained to, and then if they, so most of, I've spoken a lot with these rural women who are based, who would like to do household-based work. So there are some startups that engage them, give them piecework that they can do from their home. So tie them up with such institutions that that can accommodate such things, because it's not feasible to just remove them from their setting. That doesn't work at all. And even when you're doing something like Skill on Wheels, maybe be more sensitive to the needs of the community and their aspirations. And of course, digital skilling is taking off very much. You must know a lot of women. There are so many of them on Instagram. They are selling their stuff, and of course that's not all accounted for. So much of that doesn't show up in any statistics, of course. And then so the basic thing that you can do for them is give them some entrepreneurial training. A lot of this livelihood mission, it also does some things like this, where you're training them in financial literacy, digital literacy. You tie them up with SAGs. Through the SAGs they get these micro loans, and then they're able to start up something on their own. So for them that is easier to do. So that way we can look at solutions.
Just a small follow-up question. This is just more of an economic concept, but would you count labor, like the homework that you do, care labor, as labor? And how would you see it economically, I guess?
Yeah, definitely there's a lot of, like I was saying, there's a lot of work going into scholars. There are my seniors also who are looking into how can you put a number on that labor. Then you can get it into your national statistics, and then it is counted as labor, right? But that's also a double-edged sword, and then you will probably not be addressing a lot of the barriers. Those women, some of them may want to get out of those four walls also, and then you will say, no, we are accounting for your labor and you're getting paid for this. It's tricky. Some of these questions in policy are always tricky. But then acknowledging that it is work is important. Yeah.
One sec, I just give you the mic. It's on YouTube now, live. So people have to hear you. Yeah, I'm Ranjini, Professor of Public Policy at RV University. We were just discussing, how do we break out of the stereotypes, tailoring program, beauty parlor courses for women, and how do we kind of break away from that and do something else? So what are your recommendations?
In terms of the trainings that is provided, yeah. So government is now shifting towards demand-driven training that is data-backed, where you're able to look at a district and you're able to find out, okay, these are the key clusters there. This is where local demand is actually there. So they're trying to work that backwards and say, these are the job roles we will introduce. We will get industry partnerships to do these jobs for us. So what's been happening till now is it's more the partners that are coming in. So all of this is usually done through third parties, most of the trainings that happen. So they will, what is the easiest training to do with least amount of infrastructure and very little loss? It's beauty therapist, and you just put a couple of sewing machines and then you're set. Then you're not looking at higher end skills and all of that. So you need more partners coming in who will take these up and then bring more diversity there.
Hi, my name is Hemlata from the RV University again. So something which we also spoke was, for example, in case we send a proposal to any of the funders and we say that this is, the beneficiaries are the girl children, but then we are planning to launch an electrical course, then it's a big no-no. While we do the same kind of implementation and we change the beneficiaries to males, it gets approved. So that's the mindset which I think we need to change, rather than, you know, we change the beneficiaries here. And that's was another part of the question as well.
It's very it's multidimensional. The socio-cultural change that is required, the mindset. Even from the leadership level of the most informed organizations, you will find such a mindset that why do electrician? Women won't take it up. And maybe immediately women might not even take it up. And there is a valid point for that as well. Like I was saying, maybe they have never imagined themselves as being in technical jobs. They've only seen women doing these kind of roles. And then also, why do women choose something like beauty therapist, or why do they go for tailoring? It's something they can do from their homes. So again, it's all, you know, very interconnected. There is no unidimensional answer to any of this. But I truly believe that if it starts somewhere, the imagery, the classroom teaching, all that has a very high relevance for this. Like one of my professors wrote a paper that the classroom environment, that what the teacher thinks and suggests, that has such a huge influence on the child. So if the teacher itself, she or him, they are themselves biased, and they say, you know, you're not meant to do this job, and then for all their lives they will carry that image in their head. So like I said, you know. So I personally, I have a problem with elevating women to goddess in the terms of she can do everything. She's a superwoman. Yeah, I mean, yeah. We were talking about this, yeah, over lunch as well. I was just seeing an article or something, and I don't know which professor. She said, "Save me the Women's Day cake." You know, I don't want that. You're just glorifying, like you said. I don't want that. You give me the comfort where I can juggle these roles and do it easily. But our systemic challenges are such that we are not even ready to hear that conversation. You will have hundreds of people who will say, "My mother did it," you know, but the times are changing. It's more demanding now. To have been a student in kindergarten, I'm so glad I'm done with all that phase of my life, because just imagine the workload that a kindergarten kid has now. So it's so demanding that women. Actually, I was reading this. You know, like somebody was talking about. Some student was bringing this up that. In a lot of countries like Japan, South Korea, the rate is coming down. The birth rates are really coming down globally. And we are going below replacement rate also in some of the countries, like less than 1 also. why? Because we don't have solutions, systemic solutions. So women are saying, I don't want to give up on my career and profession, so I'd rather not have a child, I'd rather not get married. And then there are now governments incentivizing women, we will pay you if you have, Russia is saying you will pay you if you make 8 kids, all that. So, and South Korea is it's a completely different story that's happening there. The crayons that kids were using in kindergarten are now being used by people in old age homes. All the kindergartens have been converted into old age homes. So all these is again tied back to that original thought and belief that women can do everything, and women have been doing everything for so long, so they can continue to do it. So that I think is the tough challenge. Mm. Yeah. No, you brought that point very clearly. Now you're looking at images of celebrities and saying she's an entrepreneur, she's also an actor, she has 2 kids. But look at all the resources that she has at her disposal to do all of this. When you're looking at an informal worker who does not have a creche at her workplace, who's probably a single mother, then where are those resources? You cannot compare her and say if she's managing, you should also be able to manage, right? So that's an unfair comparison. Yeah, thank you.
Thank you. I would now like to invite Deepa Lakshmi to please hand over the token of gratitude. Thank you very much, Ms. Amrita and Dr. Grace, for moderating the session. That brings us to the end of the technical session for the afternoon. Now we will have a short research presentation by Dr. Ranjini Raghavendra, Executive Director of the Center for Global Health and Development. She is a doctorate holder from the Lancaster University and was a research fellow at Cambridge University, UK. She has worked as a researcher in institutions such as IIM Bangalore and NIAS. She was an advisor at Google Health AI and has consulted on several research projects for the World Bank, WHO, London School of Economics, Public Health Foundation of India, and the University of Oslo, Norway. And she's also done a media stint with the New Indian Express, Bangalore. She's a versatile scholar with 3 decades of experience in different sectors such as academia, research, corporate, NGO, and media. Please welcome Dr. Ranjini Raghavendra, presenting on gender and health policy perspectives in India. Please put your hands together.
Thank you very much, Mahe, for inviting me, Dr. Annapurna, Dr. Harini, and the entire team. So since morning, a lot of discussions. We've had a lot of insights on gender, health, education, labor. It's a very important topic, and I'm very glad that you have taken gender as a theme. So happy, and thank you for that again. So in this, it's not a PPT, it's my thoughts and notes that I've put together. I would like to share my research journey and my insights since last 2 decades. I just want to start narrating 2, I can't call it case studies, it's just a vignettes from my fieldwork. I'm a qualitative researcher very much interested in ethnographic research. Do you all know what ethnographic work is, research is? You go to the field, spend some time, understand the context, understand your participants, understand the socio-economic, cultural nuances of that place. So that's the kind of work that I'm interested in. So for my doctoral work, I did ethnographic research to understand the use of technology, information technology in rural primary health centers in Andhra Pradesh. That was my doctoral work at Lancaster University. I came to Andhra Pradesh and I was there in Andhra for about 10 months, and I did the work, going in deep into the villages, tribal areas, primary health centers, working with ASHA workers, healthcare workers, to understand what data they were collecting, what kind of health services that they were giving, and also sitting at the primary health centers to understand from the patient and beneficiary perspective. So this is from so this presentation is kind of a synthesis from 2 decades of research in this field. So I would like to first tell you a small story. It's from the field work. I was asked to go to one place by name Vidisha in Madhya Pradesh. I was a consultant for that project, which was funded by Bill and Melinda Gates Foundation. And this was on anemia, iron and folic acid tablets that were given, and they wanted to understand behavioral communication between the Anganwadi worker and the women there. Okay, so it was pretty simple. They said that somebody will come and pick you up at that particular time. You have to go to the Anganwadi center and just observe what is it that the Anganwadi worker is telling the women. And they had given the script. So we visited maybe 2 or 3 Anganwadi centers, quite far apart, in different villages. So these two incidents is etched in my mind, because they brought in 2 different perspectives. So we went in the morning and we waited, and Anganwadi a worker was there, and she was given a script. So what happened was 2 women came, and they were in Gungat. I could not see her because throughout entire half an hour, 45 minutes, she did not remove her Gungat. And so she just read out the script. Whatever it was there, she took the paper and she read why IFA tablets, little bit about anemia and why it's important, okay, for her to take. And the intervention was that after that she gave them a calendar. In the calendar, after she takes the tablet, she had to scratch. You all remember the scratch cards? So she had to scratch one box, and what would appear on the calendar was a smiley baby. So every time she took a tablet, she had to scratch the card, and a face of a baby would come. So can you imagine it was an ordinary calendar, with lots of babies. So if she took 30 tablets in the month, she would have 30 faces, cute babies on the calendar. So this was just to motivate her. And if she's missed that particular day, it would be a reminder that you have missed 2 days in a month. So 2 boxes would be missing. So in the first Anganwadi center, she just read it out. And the counseling session was over. So this was one. Then the next village, we traveled for another 1 hour. And in the next village, what happened was the Anganwadi worker was very proactive. She did not open the script. She just read through it. She understood the content. And what happened was she connected with the lady who had come in. She said, all the conversation was in Hindi. How are you? And little bit about her life, and then she asked, at what time did you eat breakfast? Then she said, I did not. Then she said, you have a cow at home, you have a lot of food at home, food, fruits, are you eating any? She said, no. Generally, at what time do you eat your breakfast? She said, I skip breakfast and I eat lunch. So all this informal conversation put that women at ease. She was able to connect because she is not from that village. She is a daughter-in-law. And her mother's place is in a different village. So the connection with other women is very limited. The networking is very limited. When this Anganwadi worker spoke to her, had a conversation, she was able to connect, and then after that she brought in this element of anemia, IFA tablet, why it is important. You already had a miscarriage, you should take care of your health, you should eat properly, food, nutrition, all those aspects she brought in. Why is it that I am narrating this story to you? To help you understand what socio-cultural nuances are and how it impacts our daily life and the health. We may be talking about health policies, health programs, health schemes, but at the ground level, these are the issues that are important, that impacts our health, okay? So this is the context that I want to bring in. That was from Madhya Pradesh. The next is from Karnataka. There is one scheme called Matrapurna Yojane. How many of you have heard about this? Okay. Matrapurna Yojane, in the morning we heard about Dr. Uma Mahadevan. It was her brainchild. Food is, fresh food is cooked, prepared, and registered women can go and have lunch in the afternoon at Anganwadi center. If she's pregnant and she's registered, she can go and eat lunch at, this is the program. Just like the midday meal scheme for children, this Matrapurna Yojane is for pregnant women and lactating mothers. They can go and have lunch at the Anganwadi center. But the programs, it's a very good program, isn't it? For free food, you just go walk into the Anganwadi center around lunchtime, eat and come back. It's a very good program, isn't it? Don't you agree? So, but when they did evaluate the program, monitor there is what is called monitoring and evaluation, right? When they evaluated the program, lot of cultural, socio-cultural issues came up. One is, women found it very difficult to walk in the hot sun in the afternoon. Anganwadis are far away from their residence. Just to have one meal, it was difficult. Most of the women are working in the fields or at home. They found it very difficult to go. And also caste issues came up. If the cook is of a lower caste, they did not want to have food there at the Anganwadi center. Going to the Anganwadi center itself was a bit difficult for some women because they did not want to do that. So a lot of issues came up, and that was presented, research was done by Center for Budget and Policy Studies, and they presented it to Uma Mahadevan ma'am. This was also with UNICEF. So government, from a policy perspective, they might come up with schemes, give a lot of budget allocation could be there, but there are other issues which will come up. So what I would, this is just to give you a context, these 2 minutes, and I would now like to move on with the presentation. So gender plays a significant role in health outcomes due to biological and socio-cultural factors. Gender norms and roles influence disease exposure, healthcare access, which we have already talked about. Gender norms, women might not seek healthcare. They might not have access to healthcare, and health-seeking behavior. So this is, they may be suffering, they may have problems, but are they comfortable going and talking to someone else, or going to the doctor and seeking care, health care? So briefly, NFHS 5 These are just two key findings. Child marriages are very high in Karnataka. You may all know about it. And also anemia is 50% of women in India are anemic. So there is Anemia Mukt Bharat program, high prevalence of anemia. So that is one. And social determinants of health. This is another concept that you need to all know about if you're interested in health policy. Conditions in which women are born, raised, and live. This is kind of a social determinants. That determines their access to health. This determines their healthcare decisions. Education plays a very important role. Literate women make better health decisions and they seek health care, and that is the reason it's very important to educate women. Okay? Lack of education and low socioeconomic status limits women's access to healthcare. And financial barriers, out-of-pocket expenses prevent women from seeking necessary care. High fees. Of course, there is insurance now, PMJAY and all that, but still they like to go to a private clinic. If at all they go, and it's a huge burden, especially for poor women. And indirect cost in terms of transportation, if they have to take an auto to the hospital, nearest hospital, and then after that, it's the medication, it's for 3 days, 7 days, they cannot afford it. Also deter access to healthcare. Then environmental conditions, we all know this, air pollution due to cooking fuels. Now we have gas connections, but in rural areas it's still a problem. And poor sanitation and menstrual hygiene. This is another area which is of concern, and because of that, dropout rates for women. If there is no toilet and if they have to go to the next town for their high school, they drop out. The sanitation affects their access to education, which in turn kind of affects their health-seeking behavior. So now I'd like to move on to gender equity. Do you all know about the difference between equity and equality? Okay, you know about it. Okay. If not, I would like you to go ahead later on. Just go Google it, and you will see lots of pictures. You will be able to get it. Yeah, just Google it later. Underrepresentation of women in policy making leads to gender inequitable policies. Bottom-up policy approaches. So this is very important, which we did not talk much in the morning session. So bottom-up approach, how do we do this? How do we bring in policy from a bottom-up perspective? The way we do it is we talk to the stakeholders. If it is a group of women, we have village health and sanitation committees, VHNC, nutrition sanitation committees, Anganwadi workers, Asha workers come, and they consult the local women on their particular issues, and they bring in, or it could be gender budgeting also, which I'll talk about later. They bring in kind of a consultative and make policies around that. So that's the bottom-up approach, focusing on local, regional, specific solution rather than policy being very top-down. Community engagement and women's forums are essential for inclusive policy making. The need for gender-sensitive monitoring and evaluation of health policies like the Mathrupurna Yojana. Lack of evidence-based research hampers policy effectiveness, gender-based data collection, and operational research. So, research based on evidence, policy based on that particular evidence is crucial. Structural and organizational barriers, male-dominated norms shape leadership roles, reinforce gender inequalities, and many a times prevents women from advancing into leadership role. They continue to be in mid-management or lower management levels, even in health sector. Rigid gender expectations in health professionals persist. For example, nurses. They are stuck in that, they don't go up the ladder in hospitals, so limiting their progress. So we all know about government health expenditure, and I'll skip a couple of these. Women in healthcare often face short-term contracts with limited benefits. So what happens is there is break during maternity, and that hinders career progression. So and also they are on contractual positions, so this affects them moving up the ladder. Women in India spend 35 minutes per day on unpaid care work, while men spend only 40 minutes. Gender norms pressure women to prioritize family, domesticity, impacting their, even they don't see themselves as leaders, and they don't aspire to be leaders. Female healthcare professionals report difficulties in networking, especially after office hours. For example, if there is a networking event or a meeting after 5, women will like, I want to go back home, I have other responsibilities at home. So that kind of impacts their, or if there is a meeting outside of town, they don't want to go. So this affects their networking. Networking becomes very important when they want to make a career progression. So women are often confined to program-specific roles rather than strategic leadership roles, and also mentoring. Women, female role models and mentors in senior leadership positions, they play a very important role in kind of nurturing and encouraging women to move on to leadership roles. Inadequate medical maternity leave and childcare support, sexual harassment. We all know, you all know about the Kolkata case, safety of women at workplace. So that is one. And gender-based violence and gender budgeting. I would like to talk a little bit about gender budgeting. It's very important that gender perspective is included in budget. If not, the financial allocation goes to whatever men decide. So gender budgeting is crucial to make services accessible. And I would like to conclude by saying that improve regulation of the private sector to ensure gender equality, increase government intervention in public health training and leadership programs, and strengthen legal frameworks to prevent discrimination and support women in leadership. And ensure flexible hours and improve child care support, and platforms for women's leadership and networking should be created. Thank you.
Thank you, Dr. Ranjini. Now I'd like to ask you if any of you have any questions to ask to Dr. Ranjini.
Despite being, we would have loved to hear more from you, Ranjini, but I think it was good you were sort of tying up some of the points that the other 4 speakers started with, and it sort of fitted into our theme of gender and policy. And I think what you brought out is some of the key points that students can and should, I think, work on or read more about or discuss more about it. Yeah, I think that's very important.
Now I'd like to call Sarah from first year MA Public Policy to facilitate Dr. Ranjini with a memento. Thank you, ma'am. Now I'd like to call Palak, our PhD scholar, to present the vote of thanks.
Good afternoon, everybody. Yes. Good afternoon, everyone. Some moments don't just happen and disappear. They stay with us, shift something inside us, and leave behind thoughts that refuse to settle. SAMAH 2024-2025 was never just a conference. It was meant to be a conversation that stays, a way to look beyond policies and rules to the real lives they shape, the power they hold, and the voices they often leave out. Today, we gathered not just to listen, but to deeply listen to the unspoken, to the urgent questions that refuse to stay unanswered. We spoke of gender and policy, but what we were really talking about was life itself, how it is shaped, measured, and too often constrained by rules written in ink but lived in flesh. So to our esteemed speakers, starting with our keynote speaker, Vivanjala ma'am, Professor Anita Kurup, Dr. Anupama Shetty, Ms. Amrita Girish, and Dr. Ranjini ma'am. Your words have not just filled the room, but they have filled the gap that often exists between policy and the people it seeks to serve. So thank you for lending your wisdom, your courage, and the weight of your experiences. To Dr. Annapurna ma'am, thank you so much for setting the stage with warmth and insight. All the faculty members, students of Department of Public Policy and HOD Dr. Harini, thank you so much for your constant support and guidance. To every participant who sat through each session, who questioned, who debated, who carried these conversations beyond the walls of these rooms, thank you so much for being here and making this place alive. Heartfelt thanks to the organizing team. So they worked behind the curtains so that the stage could shine. So today we leave this room we still have an activity, but to our esteemed speakers, we leave this room not with conclusions, but with questions that we refuse to be answered and not stay silent about. Perhaps that's the true success of SAMAH, not in what we've said, but what we will continue to ask. Thank you so much.
I also would like to add a special thank you to both Palak and Sanjay, who've been running behind, trying to organize, putting things together, breaking things, putting things together, breaking things, planning, replanning. But it was a pleasure for me to work with both of them, and we're glad it finally happened today. You know, thank you very much. And once again, as Palak said, thank you faculty, students from BMSCL, you, Dr. Hemlata, Dr. Ranjini for coming. We would have loved to have more students, but that doesn't matter. I think the small group itself was very good. Now that we have listened to experts, we are going to have a small activity to put to practice what we have heard in the morning. So what we've done is, we're dividing you all into 3 groups, okay? Okay, Sanjay requested that we break for a cup of tea, but let's come back in 15 minutes. The activity is only for half an hour, this thing, yeah? I'll then break you all into groups, but I request Dr. Grace, Dr. Prashant, and Dr. Priyanka to be in each of these groups, just to guide and give them mentor and things, yeah? Thank you. Let's just go in for tea. Yeah, sorry.
The students from the external institutions, they wanted to see around the campus. Same with Dr. Ranjini and everyone.
using my mic? I'm so loud. This is going like this. Why? Dr. Priyanka, you were with education. So all group two, you want? Okay, it doesn't matter. Group 3 education and Dr. Grace skilling, group 2 skilling. Doctor. Now, clearly, very simple case study has been given. So divide yourself into groups over here. Thanks, Dr. Prashant, for taking them there. Somebody will read in your group the case study, and there are instructions are given. Read the case study, discuss the same amongst you all, try and answer the questions provided, and you need to present it to the larger group. Your time is, it's now 4 o'clock, 4:30. You have to make the presentation. Sanjay has been very kind to keep some chart papers. Yeah, chart papers and pens that work. It works, no? Pens that work, pick up, because when you make the presentation, what is your number? And what's yours? 2. So wherever 2 is. Yeah, come here, 2. If you want, pull some chairs here and sit face to face. If you guys want to pull the chairs here and look face to face, is fine. They've taken a nice little round over there, which is good. Okay, anything that you all want, you have Dr. Grace in your group to help. So your role is just to see that they're doing, if they have any questions, to just guide them, like a mentor and guide them. That's all. They will do everything, but you're the, as I said, the boss. Yeah. Yeah. You give gift to everyone. So Dr. Prashant will listen to you all. If you all have any questions, anything, he'll be your guide. But you guys will be the ones working. Same with Dr. Grace, Dr. Priyanka. You will just smile and sit and look at them and listen to them. And when they ask you to speak, then you can speak. Till then, no, if they have any questions, they're all smart kids, they don't need. But if they have anything guidance, they'll contact you, okay? Any questions? I'm also over here. Anything. What you do is, after some time, what you do is, just go around what they're discussing, some points which you do. This documentation is all. Yeah, I read it. Then I put it with money content. Oh, okay. No, I think it's funny to speak so well. Then you put it nicely, you know. I enjoy it. See, all your, both your mehnat is just come out. I think for all our activation, it's not, I think it's good. I think it's good we change the vision. Good we say no for the future. So the big thing is sending a mail. We have a Actually, you keep it here. They will be looking. Just keep it here when they're present. Very good. Now, just one or two when they're present. It will make the groups see that
Good evening, everyone. The case study that was given to our team was Kerala's COVID-19 management. And based on this, we had some questions and we had note down the answers for it. And my teammates, Kirtana and Varshita, will be presenting the answers. So our first question was, what are the foundations upon which Kerala's initial response to COVID-19 was done? So I invite Kirtana to do the, Varshita will do that answer.
The answer is foundations as swift actions and strong public health infrastructure, community-driven approach. So the swift actions, and it was preparedness. The state had protocols in place even before the first case was detected, and also strong public health infrastructure, experience from handling Nipah virus and other Kerala implemented containment measures efficiency, decentralized government, community-driven approach and innovations. The state established COVID first-line treatment centers and testing kiosks to prevent overcrowding.
The second question we got is, what roles does decentralized governance and community-driven approach play in the containment of a large-scale crisis?
So the decentralization of governance allowed the quicker decision making in taking the control of the government where it was necessary. And next, the community participation, where the ASHA workers and other volunteers help the local citizens to quarantine themselves and to find out how to help them cope up with the COVID-19 guidelines given by the state government.
The third question we got is, what policy mechanisms can help sustain public trust and compliance in prolonged public health crisis?
Policy mechanisms, transparent communication and decentralized decision making. So transparent communication, it is for based on regular updates and clear guidelines helps maintain the public confidence. And decentralized decision making involves local authorities, ensures faster and more effective responses.
Fourth question is, what role do political dynamics play in shaping public health responses, and how can policy be insulated from political disruptions?
Political dynamics in healthcare. The first one was Sprinkles data privacy controversy, and next methods were like strengthening institutional capacity, promotes transparency and automability, public engagement and participation, cross-sectoral collaboration. So health responses were like political decisions such as sprinkler data controversy affected public trust, and coordination with the central government played a role in securing medical supplies and funding. Delays in involving private healthcare providers created gaps in capacity. Policy insulation from political disruptions can be achieved through institutionalizing emergency health responses, ensuring independent expert advisory bodies guide policy decisions.
The fifth question is, what policy recommendations can be drawn from Kerala's experience to improve future pandemic preparedness?
Policies like early and widespread mass testing, where the testing for asymptomatic cases were being detected. And next policies, they were strengthening public and private healthcare partnership. Then data privacy frameworks, where they ensure digital surveillance without ethical concerns, economic support for vulnerable populations to encourage compliance with public health measures. Next question.
So the sixth question is, what role does community participation play in public health emergencies, and how can it be institutionalized in policy frameworks?
By formalizing volunteer networks in emergency situations, systems, integrating community health workers to decision making and public health planning, decentralizing healthcare budgets to enable local government to allocate necessary resources, education and awareness programs to empower communities about the crisis management. Thank you.
Any questions from anyone, any observation? How much of this presentation that they made related to the presentation made by Amrita Girish? She spoke on skill development, right? This was, no, this is on health. Sorry, Dr. Anupama Shetty. What did you all understand from their presentation? Was the policy a success or a failure or not so good? What they presented? Anyone? You are not listening? Or didn't follow? Would you like to just give a couple of points about this, Kushi?
Okay, I think I should begin by just setting the context for what the case study was, because I don't know if everyone knows what the case study was, right? Oh, so, but I think I'll just generally go over it. So basically, what in health is the fact that when Kerala was hit with COVID, they had really good response to it initially, and this is based on the fact that Kerala in general has a really good governmental infrastructure for healthcare. They have a lot of ASHA workers on ground, it's really decentralized, they have a lot of PHC networks, and it's a very well coordinated system. So when COVID came, they undertook a lot of rapid testing. They did a lot of contact tracing. So if someone had COVID and whoever they got in contact with were tested. And so in the initial phase, so they had a COVID case, I think around Jan 20th. For the next 40 days, there were no other COVID cases. And this happened because of the fact that they were contact tracing so rigorously. So this is again evidence of the fact that there was a good response. However, what happened was that as COVID was a really long pandemic, right? 4 years is a really long time. So after 1.5 years or so, a lot of fatigue set in, the institutions started failing. There was a lot of, so like ASHA workers, the PHCs, they got overburdened. So they started slowing down in their processes. There was a lot of backlog of medical procedures that happened. Then there was also the political disruptions that they talked about. So the sprinkler data, data privacy, what happened was the fact that the Kerala government took on the sprinkler company to manage the data for the COVID response, but they never did it through a judicial process where they sent out a vendor and then they were elected. They just took on a company, which suggests, corruption, suggests like interlinkages between these parties. So that was a problem. Another problem was massive surveillance. So what they did was that whoever had COVID, they would put GPS locations on them, they would trace where they would go. They had police chasing after people, which is not good. You can't have surveillance in the state. So this was the Kerala situation, and this is what these guys were responding to. But I do have a couple questions. Not a couple, I have 2 questions. The first is, someone spoke about having surveillance while being ethical. I understand this is a bit out of the scope, but I just wonder what your thoughts on that are, if anyone can respond. How can you have ethical surveillance basically in a pandemic, right? Like how do you contain people and monitor people while also not infringing upon their rights?
I think the first and foremost thing that you can do is take their consent. Yeah, so that was missing here. So I think that would be a very major thing that you can do. And then
It is a hard topic, I would say that, because
yeah.
surveillance in general goes into unethical. You can't
Yes,
watch
yes.
so excessively, right? So
But with consent, then it becomes, you have the consent of the people, and then
See, I would also like to add that with surveillance, in this case, we are putting the life of people in jeopardy. So, to a certain extent, that unethical part becomes ethical because it is necessary in that case. And at that time, we didn't have any other methods to understand, apart from contact tracing and everything. So to a certain extent, especially when life of the people are in question there, then I think it's okay to a certain extent.
So, you know, this brings about the point of, you know how we talked about in the start of the conference about good policy and bad policy. So how does it, like, how do you exactly figure out?
Again, I think Manjula ma'am had already said that it's about perspective.
Exactly.
See, it's, yeah.
So would you take individual privacy over collective health, you know?
In that case, I mean, during the pandemic, the entire world went into a standstill. So during that time, I think people prioritized the health of a community over the privacy of a few people and everything. So there's no good or bad again.
Another point that comes about in coherence with what was spoken about during the health presentation is the idea of decentralization. What really worked with Biocon Foundation is the fact that it was door to door, right? Because you're going to the people, it's on first, you are actually approaching people. You have to answer. And that's happening because you have things happening at the local level, at the PSC. Which is the same response and the same infrastructure that Kerala has, which is why you have good health governance.
Thank you. Great job. Thank you. Next group. We'll send you all the case studies to everyone, others also to see, because we're running short of time, so that's why I'm not asking you to share the case studies. Just a question and an answer. Thank you. You can just
Should I
tell the
introduce?
title of
You
your
take up
case
the
study
questions.
and-
No, she said introduction is not required. The case study that we had received was skill development and India mission, and how did it work overall? Like, was it a failure or was it a success? It was implemented, like first launched in 2015, and basically, like 2006 reports of 2015 and 16 weren't so great, and 2017 the government abandoned this mission. And again, then they looked into the lacunas of the policy, and they came up with certain solutions that could, be worked upon, and the policy was reframed, bringing upon a bit of changes in the policy. We'll just jump on the questions. Like, basically, we were given 6 questions. The first question was, how can skilling programs be registered and redesigned to ensure better job placement rates? According to the data that we got from 2015 and 2016, it was something around like the training that people received was, candidates were 19.85 lakhs, but only 13% of them really got employed. Like, they were, this is a very poor ratio. We can say, like, when 19 lakh people are participating in training programs and only 13% are getting employed, there was something that was lacking in the policy. So we came up with a solution that the redesigned policy could include more of aligning with specialization in particular industrial sectors. Also, we could focus on soft skill development, like communication, problem solving skills, and practical skills overall. The second question that we had got was, what are the ways policies can codify state government training providers and industrial bodies coordination? So the second question that we answered was like, we can have collaboration with development councils. Like, we can set up regulatory bodies which are getting this checks and monitoring done on a regular basis. Also, representation of different stakeholder groups and regular meetings of these stakeholder groups can improvise the enforceability aspect of these policies. And also, incentivizing the collaborations. That was what we felt could help redesign these policies.
So the fourth question we got was, third question was what lessons can be learned from successful state level skills. For example, Tamil Nadu's Nan Mudalvan scheme. We could analyze that they focused on the local needs, and their partnership, the public-private partnership, was excellent, and they provided personalized support to the people in need, and the use of technology, the technological intervention was one such area. And then regular monetary and feedback was one such part of the policy. Fourth question was how can local governments engage better with central policies to map skill demand at the regional level? Ma'am, that's my writing only. Local governments can engage better with central governments in terms of data sharing. They can have regular monitoring and feedback in case of the development that is happening and the nature of demand and what kind of skills are required in the job market. And yes. Fifth question was how can skilling programs be made more inclusive for women and marginalized communities? Inclusive education, women targeted curriculum should be made, and gender sensitive curriculum should be made, and safe and accountable environment and spaces should be delivered to women. And in case of financial emergencies, financial support should be provided. And the last question was how can policies be made forward-looking and adaptable to the future of jobs? This requires foresight and research, basically incorporating the future skills, for example, AI, in the curriculum, and including the training programs that are in demand, and then upskilling and reskilling according to the demand in the job market, and collaborating with different partners and industrial collaboration. Thank you.
I'm sorry, I won't be able to have some questions because I think the hackathon team is going to come over here. Yes. But may I ask the next? Thank you very much. Thank you. Thank you. Louder clap. You did a good job. Yeah, just now. They're going to come here after this presentation. It's going to be here. Thank you. Come. After this presentation, everybody's got to be here because the CSS people want to announce something to you all. So I've been asked that all across the stage. Thank you.
Hold this, come, hold. I'll do the introduction, you guys. Yeah. Hi everyone, we are team 3 and our topic was education. So we were given the case study of Delhi educational reforms, and it was mentioned that the funding for schools had been increased and infrastructures had been developed and teacher training programs were integrated. So the questions that we had gotten and the answers that we had written will be taken up by Sanjana and Vishishta.
And the first question is, what policy mechanisms can encourage greater parental and community involvement in government schools? So it involves like SMCs, that is school management committees. These allow the parents, teachers and other local officials to oversee the school accountability and funding decisions, and the PTMs, which is the parent teachers meetings, and which structured and mandatory to ensure the parental engagement in student progress, and voluntary programs, which also encourages the parents and community members to participate in school activities, mentorship, and extracurricular programs, and the community partnerships with collaborating with NGOs, business, and alumni networks can enhance resources and engagement. And the last one, the digital engagement platform, which like schools can use mobile apps or websites to update parents on school activities and policies and performance. And the second question is,
second question is, how can holistic curriculums such as Delhi's happiness be integrated into the mainstream education policies? The first one would be incorporation into the state or national education policies, then teacher training and awareness, then evaluation metrics beyond academics and scalable models, which explains the piloting programs in selecting schools and expanding based on outcomes. And the last point would be public-private partnerships, which helps to support from educational organization in specializing the social emotional learning.
and the third question is benefits and risk of decentralizing school governance. So first, the benefits are the infrastructure and maintenance to world block level authorities and efficient dispute resolution, and even better decision making. Local school authorities can address issues more efficiently, and community involvement increases engagement from parents and stakeholders. And the risks are delay in caution due to rigid hierarchy, and lack of uniformity creating, and risk of mismanagement, like without proper oversight, funds and policies may not be implemented efficiently, and political influence, like local governance can be affected by political and personal agendas.
The fourth question is, how can technology and private sector engagement be leveraged to improve the public education at scale? The first one would be skill development via technology, and the first point would be skill development via technology, and second is addressing digital divide in rural areas, and PP model, which is public partnership model, and monitoring and evaluation systems.
And the fifth question is, what accountability checks can be introduced through policy to ensure the continued improvement and stability of newly reformed Delhi education system? So the escalation matrix and real-time redressal mechanism and multi-pronged accountability structure, and even public grievance mechanisms, like allowing parents and students to report issues, and annual review reports, like releasing transparent performance assessments of schools, and third-party evaluations, like independent agencies should conduct audits of school infrastructure and teaching quality.
The last question is, what perspectives are important when framing an education policy? First, it would be the financial background. Second, socio-economic perspectives. Third is skill and employment. Fourth is supply and demand. Then comes the political and inclusivity. And after that, we have community and parental involvement, incorporating the feedback from local communities in policy making. Thank you.
Why can't you announce? We are donating to us. They are donating books. Yeah. Good evening, everyone. Thank you for joining us. We'll just start the event. We are happy to announce that the Center for Civil Society is very kindly donating some books to the Manipal Library and to the department also. So may I kindly request the receiver and the giver to come here.
Hello, sir. Please come.
These are just some of our publications
Yeah.
over the years.
You can use this to just
So CCS is a think tank. I think maybe Bhavya will tell more about it. But we established in 1997, so it's about 28 years. Over the years, we have done many publications. This is very small sample, but I am hoping that we'll send you more. And please, it would be great if you could add to the collection of the library. Those are mostly in the areas of economics, public policy, a bit on environment, and that's pretty much it. Cool. Yes. Of course. Yeah. And they are written by scholars, top scholars around the world. Some of the publications that we have done in the past also have essays by Nobel laureates because of our long-standing relationship on these ideas with them. So they have contributed to those publications. It would be great if it gets added here and maybe students can benefit from it. Yeah.
Authenticated resource to the library.
Okay.
So it will be a great resource to the library as well. So hope everyone uses and make use of these wonderful resources. Good. Thank you very much for the kind donation.
And one for the department.
You can receive it.
Thank you, Dr. Andy. Thank you.
these ones? This one only, not this one? And for this,
Excuse me, this works.
this works, but there's no live recording, so they want these maps. Yes, we have 5 teams. So 3 are citizens and 2 are citizens. Right. Good evening, dear guests, distinguished jury, and our talented finalists. A warm welcome to each of you to the PRISM Policy Hackathon Finals. We are thrilled to have you here today to discuss one of the most pressing issues of Bangalore, that is urban flooding. Before we dive into the discussions, I would like to take a moment to introduce our esteemed jury members who will be guiding us with their feedback towards the end of the discussion. With us, we have SAMAH Kohli, a water activist, educator, and entrepreneur. SAMAH has a background in films and development communications and journalism. Also trained in nature-inspired leadership for social innovation from biomimicry for social innovation in New Mexico, her work intersects soil, soul, and society. SAMAH was a co-founder of Lifetide People's Collective for Water, Sustainability, and Harmony. Can we have a round of applause for her, please? We also have with us Dr. Annapurna Ravichandra, Professor of Practice, Department of Public Policy at MAHE. She has over 35 years of work experience and a PhD in history and a specialization being Indo-Portuguese history in the 16th century. Her professional career ranges from working in the university, non-profit organizations, corporate, and think tanks. She is the recipient of the Rotary Award for Exemplary Services in 1999, Vadodara, Klaus Gulbenkian Foundation, thank you. Portugal from 1985 to 86 and UGC Fellowship 1984-88. She's also received a certificate for Executive Program for Nonprofit Leaders from Stanford Business School of Graduate 2019. A round of applause, please. We also have with us Dr. Harini, who currently heads the Department of Public Policy at MAHE. Her academic responsibilities include teaching foundation and advanced courses in public policy, as well as designing policy labs for research and enablement in the fields of environment, technology, and sustainable development. She is also pursuing collaborations with national and international institutions of repute and strengthening the pedagogical frameworks and problem-based learning approaches in the programs offered by the department. A round of applause, please. I would also like to express our heartfelt gratitude to the Manipal Foundation for their generous support in making this hackathon a reality. And of course, we must extend our sincere thanks to MAHE Bengaluru for being a lovely partner for the event. Now, let's set the stage for today's discussion. Today's policy simulation revolves around a critical challenge, the recurring urban flooding issue in Bengaluru. Every year, the city faces devastating floods that bring daily life to a standstill, displacing communities, causing traffic congestion, and spreading waterborne diseases. But why does this happen repeatedly? What is at the root of the problem, and how can we effectively address it? This challenge is more complex than it seems. The Metropolitan of Bengaluru has long struggled to identify the causes and solutions, and today we are here to brainstorm and identify actionable policy solutions. Now let me set some context. The context for this hackathon is that the Bengaluru Municipal Commissioner has called upon a meeting of 5 different stakeholder groups. These stakeholder groups are being represented by the different teams sitting here. We have the leadership of the BBMP being represented by Lahiri and Anvita. That's the team over there. Can you raise your hands, please, so the jury can identify? We also have with us the leadership of the Bengaluru Water and Sewage Board by Shayantini Ghosh and Manjeet Pawar. The team here. Representing citizen leaders from a Bengaluru citizens group, we have Aditi, Sairam and Amala. Infrastructure Industry Association, Yash Moir and Juhi Valse. And last but not the least, we also have the Bengaluru Slum Dwellers Association, represented by Vishishta God, sorry about the pronunciation, Vishishta God and Mansi. So the agenda of this mock meeting will focus on identifying root causes of urban flooding. We will have 2 minutes of opening remarks from each stakeholder group, followed by an open discussion. You can use your time as you please, but it is important to remember that in this discussion, we aim to identify the root cause of urban flooding, agree upon what the group thinks are the causes to be focused on, and then develop a policy pathway based on those agreed causes. Towards the end of the 40 minutes, the teams are supposed to, together as a collaborative, come up with policy actions, ideally have prioritization of these policy actions with timelines, and determine what role each stakeholder group is to play. Remember, your success will be measured on your ability to work collaboratively, engage constructively, use evidence, and ultimately build a feasible evidence-based policy pathway for solving for Bangalore's urban flooding issue. Without further delay, we will begin with the opening remarks. I call upon the citizen group to make their opening remarks.
Good evening, everyone. Good evening, everyone. I'm here today not just as a concerned citizen, but as someone who has seen firsthand how Bengaluru's flooding problem is getting worse every year. What used to be a rare occurrence has become a routine now. Roads turning into rivers, homes and businesses getting destroyed, and people struggling to even step outside when it rains. I've seen traffic come to a standstill, emergency services unable to reach people, and families left helpless in knee-deep water. It is not just an inconvenience, it is a failure of planning, drainage, and governance. And the worst part, year after year, we hear promises, but nothing really changes. Bengaluru is one of India's most important cities. It cannot afford to be crippled by something as predictable as rain. The people of the city deserve better. And how will we ensure that the next monsoon, we are not again sitting here having the same conversation again? It cannot be overstated that Bengaluru grows outwards faster than it can cope beyond its scope. Let's not wait for another flood to remind us why we are here. The time is to act now. Thank you.
Good evening, honorable judges, stakeholders, and esteemed leaders here. In our concrete jungle, urban flooding worsens as deforestation and water shortage take their tolls. But is it not just about water? It is about negligence, injustice, and survival. As unchecked encroachments choke Bangalore, we, the Bangalore Slum Dwellers Association, are left to suffer. While the rich stay dry, our homes are washed away. Our streets become filthy rivers. Our families lose everything again and again. Slums are more than shelters. There are communities of resilience, dream, and hard work. Yet every monsoon brings a disaster. Homes get destroyed, children get sick from contaminated water, livelihood wiped out overnight. But why? Because lakes are encroached, drains are clogged, and the poor remains invisible in city planning. This isn't just a natural disaster, it's a man-made crisis. We don't need sympathy, we don't need promises. Programs like Pradhan Mantri Awas Yojana and local redevelopment projects have made strides, but much more needs to be done. So I ask, what kind of Bangalore we want? A city that pushes the poor aside, or the one that stands for justice, dignity, and equal right for all? The solution isn't just a policy, it's a collective action. Government, private sectors, and communities must come together to build a city where no one is left behind. So today, let's move beyond a talk and let's act. How can we create urban spaces that uplift, not marginalize? How can we ensure that every family, regardless of income, has a home that is safe, flood-resistant, and dignified? These are the questions we must answer together, and the future of our city depends on what we do now. So let us build a Bangalore that is not just bigger, but fairer, stronger, and more resilient. Let's work toward a future where cities are not just growing in size, but in compassion, inclusivity, and resilience. Thank you.
Hi. Greetings, everybody. So it is an honor to be here representing the Infrastructure Industry Association. So as an industry association, we strongly believe that if we fail to adopt today, we would fail to survive tomorrow. And by this, we recognize that unplanned urbanization, inadequate drainage system, climate change, causing the extreme weather events have intensified the flooding process. However, we also acknowledge that the Infrastructure Industry Association is having a major role to play in both mitigating and adapting to some sustainable options. So sustainable water management, responsible land use, and collaboration with the policymakers can help us build a more flood-resilient Bangalore. We also believe that through this hackathon, we look forward to innovate, data-driven, and actionable solutions to integrate with the industry, government, and the community efforts. So we believe that let us work together to develop policies that ensure the economic growth while safeguarding the city's sustainability. Thank you, and we look forward to a constructive dialogue with each and every stakeholder here.
Good evening, everyone. On behalf of Bengaluru Water Supply and Sewerage Board, we are here to address a critical and recurring challenge facing our city, urban flooding. Bengaluru's urban floods are not solely the result of extreme rainfall, but of deep systemic issues like unsustainable land use and resource mismanagement. Over the last few decades, the city has experienced a 155% increase in built-up of concrete areas and a 93% reduction in its lakes and wetlands. These ones were vital ecological buffers that regulated water flows and prevented flooding. What was once one of the city's largest lake has now been transformed into the Kempegoda bus station, exemplifying the scale of land use alteration. The situation illustrates the hardened tragedy of commons, where Bengaluru's lakes, wetlands, and drainage systems have been overexploited for individual gains. Encroachments for housing, commercial purposes, and infrastructure development have come at the expense of collective good, diminishing our natural flood mitigating capacities. The BBMP's own survey highlights extensive encroachments in stormwater drains, further restricting water flow during heavy rains. Moreover, drainage systems are inadequate and outdated, many not designed according to the current standards of the Indian Roads Congress, nor made from porous or sustainable materials. According to a CAG report 2021, there is a lack of reliable data on stormwater flow patterns. Stormwater sewage drains lack real-time monitoring, and buffer zones around water bodies have not been properly marked, creating data mismatches and regulatory blind spots. Adding to the complexity, 43% of Bengaluru's sewage is not being treated, placing additional pressure on lakes and drainage systems, according to the National Green Tribunal. While climate variability and changing rainfall patterns exacerbate these challenges, unpredictable high-intensity rainfall events are overwhelming the city's infrastructure, already strained by the loss of vegetation cover, catchment degradation, and unplanned urban expansion. At BWSSB, We recognize that this is not merely an engineering problem, but a governance challenge. Addressing urban floods requires rethinking our urban consumption and material use patterns, integrating sustainable and porous materials and infrastructure, adopting nature-based solutions. Equally important is ward-level citizen engagement, which ensures that local needs inform systemic responses. As stewards of Bengaluru's water and sewage management, we are committed to collaborative governance between multiple stakeholders. It will take interagency coordination and robust data management to prevent Bengaluru's shared resources from becoming casualties of the commons. Thank you.
Hello everyone. Every monsoon, Bengaluru turns into a temporary Venice, but not in a good way. 96 lives were lost in 2022 alone due to urban flooding in Bengaluru. Streets flood, traffic halts, citizens suffer, and all the problems that you mentioned are very, very valid. The question isn't just why this happens, but also how we can prevent it together. Looking at the root causes, we have come across different problems, and we will look into actionable steps that can actually be implemented. As BBMP, we recognize our responsibility in tackling this challenge, and we're here today to find solutions and not only talk about problems, solutions that are practical, effective, and collaborative. Let's talk about the root causes in general so that it can help us form the policies better and understand how these can be implemented better. Root causes can be broadly classified into three major things: geographical, environmental, or infrastructure related. Now, there are things like climate change and also like silt logging on, all happening due to natural factors. But as you all rightly mentioned, this is not the only thing that is leading to urban flooding, right? There is loss of wetlands, loss of green spaces, encroachment of lakes, old and undersized sewage system, which the BWSSP should be responsible for, poor drain maintenance, lack of rainwater harvesting, etc. The policies are abundant. The policies are there and can be formulated today too. But for something to be effective, we should have a systems approach wherein everything to the grassroots level are implemented in a better way so that actual results can be seen. And for that, we need the efficient collaboration from all you people. So what we feel is that we will use a systems approach as we have come up with the policies, and also make sure that everything is implemented as by stating how you guys can take part in it.
So as BBMP, we would like to take the initiative to start this discussion about what are the actionable policies that can actually be implemented with the collaboration of all the stakeholders. And of course, we'll listen to all the views of all the stakeholders. So the first policy that we would like.
So please note the opening remarks are now done with all the 5 teams. We will open for a 40-minute open discussion among the teams where they can discuss among themselves what they agree upon are truly the root causes of urban flooding, and they also need to discuss what policy actions need to be taken up. Towards the end of the 40 minutes, together the teams should have come up with concrete policy actionables with priorities assigned as well as timelines assigned and roles and responsibilities of the stakeholders assigned. So just a logistical thing, because we have limited mics, what we can do is that if you want to make a point once another person is done with it, please start with the point. We will make sure that the mic reaches you. So don't pause because we have limited time. So please start with your point. We'll make sure the mic reaches you. So we'll start with the open discussion. Anybody who wants to go first can go first.
Challenges that we as Slum Dwellers Association feel are the root causes are as follows, like the displacement, temporary displacement, or which we can say becomes permanent at times, like when water floods the low-lying areas, where generally slums are situated, like slum areas are those areas which are like one or group of individuals living in the same roof, like in same urban locality, where they have very less amenities, like either of the 5 amenities that a basic decent living should have is missing in these places. They don't have durable housing, permanent structure that provides protection from extreme climate
conditions, sufficient living areas, no more than 3 people sharing a room is the basic necessity that UN as a report, like in the report of 2006 and 7, UN has prescribed this in their guidelines that a room that is shared in between more than 3 people is not a perfect place to have a sustainable living for a longer duration of time. The third thing that we feel is which is a characteristic of slum areas is they don't have access to improved water facilities, potable water, which is one of the dire necessity. We can say that oxygen, water, and a good place to live are very basic needs that any human could deserve. We talk about their incomes, it doesn't mean that they are deprived of basic human rights that UNO and United Nations give them, and we are no one to deprive them of these rights. Also, they don't have good sanitation facilities, no healthcare facilities, as well as they are forced to evacuate places in conditions of floods and natural disasters, wherein just imagine a situation where you're living for more than 7 or 8 years, one fine day, it just rains out of nowhere, and just because the area where you are living is a low-lying area, the whole city's water comes and floods to that area. And then you are forced by the government to just evacuate the place, you're given a temporary solution, and you don't know for how many more months you have to live there without basic necessities, without basic you don't get time to even pack your clothes, food items. You just have to evacuate because lives are more important than what we can say as we don't get time that we should be they don't have all these planning done well in advance. So they are just told that you have to evacuate in just 24 hours or 48 hours, and then they are just, these people are picked up from some place and they're thrown to some place. Did we ever think their mental condition, their economic status, they are already poor, and then we are whatever they built out of their savings, we are taking away that also. So I feel there is somewhere where we are not able to address these lacunas of this problem, which I feel in this discussion we can come upon some solutions that can address these things. Also,
Sorry to interrupt. If you can keep it short, that will be better so that everybody gets
I would like the infrastructure committee to look into the matters of drainage and infrastructure, how infrastructure can provide better drainage systems. Also, encroachments can be something that can be looked upon, health risks, and lack of representation in public policy decision making. When we talk about slum areas, it is more than when we talk in percentages, it is more than 30% of the people are living in slum areas. Then when we talk of living in a democracy, why don't we consider their opinion? Shouldn't they get a say in the public policy formations or whatever the government decides? Should they have a say or not? This is my question to the other stakeholder groups.
So the Infrastructure Industry Association takes due cognizance of the issue, and we agree that when we talk about the population living in slums, Article 21 of the Constitution is clearly at stake. As a component of right to life, we also tend to promote right to healthy environment, which is clearly being threatened by the situation of urban flooding. Furthermore, elaborating on the point, SDG 11, which ensures ensuring cities which are inclusive. So the highlighting point here is, are the population which resides in the slums being taken into consideration for a safe and resilient, safe and resilient to prevent urban challenges like housing, transportation and disasters. And talking about the stormwater drains, traditionally, those were built to mitigate or accommodate the rainfall up to 20 to 25 millimeters, which is clearly, we have crossed that threshold in the past. So in the modern day scenario, we believe, or the Infrastructure Industry Association believes, that somewhere technology has a vital role to play, and with effective collaboration with the BBMP, we aim to leverage a digital twin model as a potential solution to mitigate the risk, and for which we would require all the stakeholders to be on board. So let me just elaborate a little bit on the digital urban twin. And it is nothing new that this concept has come over. So if any one of you might think that it is just a map of your urban city, so let me tell you that it is not clear. It is clearly not the case. While the terminology exists since 1991, I guess we have enough technology today that we can implement it for a city like Bengaluru. While Mumbai has successfully started its implementation, where the Brihan Mumbai Municipal Corporation has closed a deal with the Genesis International, which aims to create a digital replica of Mumbai city. So in this fourth industrial revolution, which we are all are part of, which makes use of automation, digitization and data-driven intelligence, we strongly believe that this digital twin would be a one-stop answer for urban floods. And to just show you all, I just have an image from, this is a pilot project which was done in Mumbai. So this is how it would look for a urban flooding scenario, where we create simulations for rightfully entering or inputting in the data how much rainfall is received and which all areas are under threat. So we can within time evacuate the population living in the low-lying areas, and we would broadly discuss it in the future as well.
The BWSSB board has applied the political economy approach to the urban flooding, which examines how power relations, resource distribution, and state actions shape vulnerability and responses to flooding. And they're absolutely right that they are the most vulnerable population who are affected by natural calamities. The BWSSB's engineers and other frontline staff have actively involved with NGOs in the slum areas and with the slum residents themselves to work together in addressing water issues. BWSSB took up pilot projects and slum programs and made changes to its own organizational structure by creating an in-house social development unit, working with slum dwellers to preempt a surge in illegal connections, informal connections obtained through political pressure, and unauthorized public taps.
So BWSSB would like to recommend in slum dwellers associations to establish community-based blue-green micro infrastructure in slums, which is the very first approach in all over the world to establish at slums level or a ward level to mitigate the risk of the vulnerability of the slum sections. Thank you.
If I may, as citizens of the Bengaluru city, I believe all of us here are citizens of Bengaluru, and nobody better than us know about as a matter of fact, how Bengaluru is now, how Bengaluru has always been, and about its historical significance as a city of gardens, city of lakes. And I think everybody who comes to Bengaluru comes for the weather, not for the traffic. We definitely acknowledge that. But before we start proceeding to how you have acknowledged your incentives and how you have measures to curb all these problems, can we start with listing out the problems first? I think the respected Slum Development Association has also pointed out very significant factors that have impacted them and their living standards. I think living is something that has to be addressed first. When there is a crisis, especially something that is causing people to lack mobility in the first place, even to step out of their houses, what measures are required is not what they can do to prevent what is going to happen in the future, or what you can plan, rather what we do to first remove the problem that is already existing. And if I may point out a few statistical data about how the primary problem, as we can all acknowledge here, is unrestricted urbanization that is happening. And we definitely think that overpopulation is a problem in Bengaluru. Most definitely BDA and BBMP and BWSSB is taking measures to incorporate everybody into the city and make sure everybody is living properly up to, it's a cosmopolitan city, and every place is in Bengaluru, every taluk in Bengaluru is of major significance. So I want to hear from BBMP about the list of lakes that have been converted into residential areas, and we believe that is a major problem for why there is flooding now. And some of the major places here, the JP Nagar 4th phase, which everybody knows is a popular destination for people who visit, the heart of Bengaluru. It was previously a lake, which was Saraki Agrahara Lake, which is in Doresanipalya within JP Nagar, was a lake which covered almost a kilometer in radius of, and of course it was shallow by nature, but it was always has historically been a lake, and that place has entirely been converted into a concrete residential area. And we cannot overstate the fact that just like these lakes that have become residential areas, have been converted into buildings, are the reason they are suffering, because the water does not have any place to go to. It does not have the place to settle. And also, honorable members, we citizens are definitely someone who are engaged in a lot of different occupations. As the authorities working on ground, you'd know better about the statistics. And we also wish to say that while coming here, have been done a research, we have strict evidence to show that there are almost 400 lakes that have dried up or at the impact of drying up. And I don't think the BWSSB or the BBMP is doing enough to curb these.
So when we talk about a problem such big as urban flooding, just saying the mistakes of past and repeatedly telling it is in a way useful, but that does not get to the solution, right? We can just accept our mistakes at the end of the day. So what we have done here is, like we mentioned in our opening remarks, we have looked at the root causes. We've come up with 5 concrete policies as to what can be done to improve the existing situation in regards to urban flooding, and also taken into consideration all of the stakeholders. But let us address one and the problems that are brought about, right? But before that, I'd like to acknowledge the digital twin model that they just said. I don't believe it's a single solution like they sold it, but I think it's definitely a good solution. But yeah, with simulation modeling, etc., and proper planning especially, we can come out with better solutions. But then let's go about and tell you how we have structured our policies. Rightfully, first thing we need to do is stop the problem, right? Urban flooding brings about so many challenges. These challenges should go. So firstly, we have mitigative policies. Secondly, we have preventive policies, that is in the long-term vision. Like mentioned in the journal, it is 1 to 5 year timeline. So we'll be taking that into consideration. Immediate policies is what my partner will be continuing right now.
Yeah, so the first and foremost policy is to improve the existing drain network. This came up a lot in everyone's opening remarks. And like as per statistics, 4,319. Yeah. So the problem with the existing drain network is that it's outdated and there are multiple bottlenecks that repeatedly overflow, right? Like in 2022, Koramangala flooded due to clogged drains. And this is something that we want, this is some problem that we want to solve. And also there have been 4,316 encroachments on the storm drains. So as it also came up in the opening by the BWSSB and everyone else, it's a major problem and a major root cause of why actually urban flooding happens. And our first policy is going to be to improve the existing drainage network. For this, we're going to do a GIS mapping of the entire drainage system, and we are also going. We will also consider doing the digital twin model that the Infrastructure Association told about. And under this drain network, we also need to do a really thorough solid waste management, actually, because a lot of solid waste actually clogs the drains. And for this, we would like the cooperation of the of this citizen group. Yeah, and under this, we also want to solve the problem of encroachments, like the Slum Dwellers Association was talking about. So basically, there have been a lot of encroachments on these stormwater drains, and the problem is that most of these slum areas lie in they actually lie in valleys, if you see geographically, which is where the water goes and collects. So the only, the solution we are proposing is to gradually but enforce, is to gradually in phases enforce a rehabilitation of the slum dwellers, so that they are actually rehabilitated to better areas using better, which have better planning basically. So
And for those of you having doubts about this policy implementation, this is evidence-based in a way because we researched about Chennai's policy and it worked. So and everything goes well hand in hand. I think it is a forward-looking, good perspective.
Bengaluru is already considered a congested place right now. How do you suppose rehabilitation will assist people who have already settled in that place for over a period of time? And
right, so that's why it has to be done in phases, right? It can't
of
be
course,
like,
of course, but yeah, I mean, something that's understandable is that residents live in a certain place because they have multiple reasons. Some people can afford to move because they have lesser things to take care, but some people have developed attachments to the neighborhood, and there are multiple factors. And rehabilitation is, of course, one of the measures, but it is not very feasible.
And to answer your question, we are not rehabilitating everybody, right? We are locating, using scientific methods. We are taking the core points, the ones that are most affected, the ones that will get most damage, slum dwellers, for example. Those are the ones we are relocating. And then I think we have a plan as to where they can be relocated into. It's not as difficult as you make it sound because we're not relocating everybody possible. And then what else would you do if you put this as null? They are left to die and suffer and get diseases. I don't think that will happen. So, yeah,
and
moving
also
on.
the rehabilitation has already happened in Mumbai. So they are actually rehabilitating the people from flood-prone areas in Mumbai, which are low-lying, and they have done it in phases, and it's turned out to be pretty successful. So as long
infrastructure industry which has like they have the powers, their jurisdiction lies in this area, and like basically they can help us guide through the solution.
Yeah, absolutely. So to talk about the what just the citizen group said about the lakes, I definitely agree to that point. Rather than directly going to where the infrastructure is lacking or where the technology is lacking, we need to also focus on the root cause, as everyone has mentioned in their initial remarks. So to talk about the lakes, we from the industry association point of view, we would like to say that we can use lakes as the buffer tanks. So when I say that we should increase the holding capacity of the lakes so that they can regulate the excess outflow of the rainwater. But this is not actually done because they don't have the sluice gate. So the infrastructure association can help to build the sluice gate. And when we say that building the sluice gate, the lakes actually are silted. So when we say the construction and demolition waste is being dumped into the lakes or into the ponds, so the lakes naturally tend to overflow. But if there is a sluice gate, there is a proper channelization of that excess water which has been collected in the lakes. So that can be one of the solution from our perspective. One of the very good example I would like to give here is the Kanamangla Lake Park project that aims to restore Bangalore's lake ecosystem by improving the water quality and ecological value. And using scientific methods, it will try to work towards more community-led sustainable resolution model. So that is one thing. And as I said that we need to focus more on the root cause, I would also like to hear from different stakeholders about the wetlands perspective, about the groundwater, and about the climate change. So if anyone...
So the Industry and Infrastructure Association just mentioned about increasing the holding capacity of the lakes. But if there are no lakes left, whose holding capacity are we going to increase? Bangalore is right now facing a 93% reduction in its lake, as I have previously mentioned in my opening statements. So Bangalore has a cascading system of drainage and lakes where the primary drains or higher lakes connect the lower lakes in the city to one another, and the higher drains to the secondary and tertiary or roadside drains, channelizing rainwater runoff into primary drains. Uninterrupted flow would ensure that excess rainwater doesn't flood, but a large number of lakes and stormwater drains have simply disappeared. That is the issue. Now, BBMP, the citizens group rightly mentioned that we the BWSSB and the BBMP have critical roles to play in the process of the drainage management as well as lake rejuvenation. But the drainage management and lake rejuvenation clearly falls under the jurisdiction of the BBMP. So, but we are here with certain insights that can help the BBMP to achieve these policy actions.
Also, the point which is highlighted by BBMP, which is the point of outdated drainage, a very major reason, a very major concern arises from this is as per the previous data, the separate master plans of BBMP and Bengaluru Development Authority had great data mismatches and drain were poorly designed and managed. So I would like to recommend BBMP to, they can collaborate with the Bangalore Development Authority and come up with the combined master plan to mark the further buffer zones around the drains and document tertiary and roadside drains. Also in collaboration with the Karnataka Lake and Conservation Development Authority, BBMP can take a project for the rejuvenation of lakes and to declare and maintain floodplains and valley zones of lakes and no activity regions. The very proven model is the Kerala's eco-disaster risk reduction model, which, where the state allocation Manrega funds for the rejuvenation of lake and cost effectiveness of the project. Also, for the infrastructure and industry association, I would like to.
So one thing that we have noticed is the very recurrent cause of urban flooding is urban expansion, right? But the massive urban expansion has not been able to keep pace with the rapid development of urban infrastructure. So the Infrastructure and Industry Association has a great role to play in it. I want to have an insight from the Industry and Infrastructure Association. Are they looking forward to transition from grey infrastructure to nature-based blue-green infrastructure like green roofs, rain gardens, tidal parks, permeable pavements and surfaces, especially in parking lots, footpaths and low traffic zones? There's example of Rotterdam where green roofs program directed at water storage capacity in recreating public spaces to mitigate urban floods. There was a 10% increase in property value, 3 decibel noise reduction and cooling effects in immediate surroundings, and cost savings of €500 per meter square cause of water avoided at ground level. Another great example is China's Spun City model of 2014, where China introduced Spun Cities. It was a revival of ancient wisdom to discharge and collect storm water. So here's a point that we can also revive the traditional techniques of flood mitigation, which has served people for years now. So data also results indicate that runoff control rate was at least 85% in cities like Beijing, Shanghai and Xinjiang. Wuhan city, Spun City faced severe rainfall events but did not encounter any waterlogging issues like it used to do before. So yeah, I would like to, really like to have the
Yeah. Talk about the actual problems and actual solutions. Let's just list out problems. I mean, all of you can openly contribute. Say one issue, we will come up, all of us can come up with one policy.
We'll identify one problem and the solution, another problem solution. We go in this method. I feel this will work.
Be more collaborative and more
Yes, that works.
Also, I think there's another key problem that we are not discussing here is the release, the amount of municipal solid waste that goes untreated.
That was addressed.
I know the policy actions regarding what are you?
I think before we come up to solutions or the consensus-based outcomes from every stakeholder, I feel one of the very basic model that we all should primarily refer to as the ADIPT model. So this has come up from the Stanford University, the design school. So they have talked about the ADIPT model that says empathy, define, ideate, prototype, and testing. So before formulating any solution or before coming up with any recommendation, I feel these 5 parameters had to be checked by every stakeholder group. So when I say about empathy, it talks about putting yourself in someone else's shoe and trying to identify the problems. If there is a need of particular policy in that area, suppose say the Slum Dwellers Association, what is the problem that they actually feel? Empathy can help us know those problems. When I say define is you actually note down the challenges. Where is the particular need of that particular policy? When I say ideate, here comes the role of all the stakeholders, that a collaborative approach. Suppose say citizen group can come up with some solutions. Slum dwellers can come up with some solution. Prototype is testing a model before it is implemented. And testing is you just test the results after it is implemented. So this 5 indicators need to be focused on before formulating any policy or coming up with any solution.
That's actually wonderful. If you could take the correct. If you could take the lead and start with the primary thing, if you want to discuss about empathy. Yes. Please start with one word or 2 phrases that will describe your problem and we'll proceed with.
The major problem which we identified was water flooding and drainage system failures. Then comes the water percolation and groundwater recharge. After that, we have lack of coordination among the authorities. So you want one? We'll go for water flooding
Water flooding
and drainage system failures combined.
If everybody feels that that concept is covered, drainage system flooding, we can cross that out. We can come back to it later, because let's address ones that have not been given solutions for. From the citizens group, I think we want to address unchecked urbanization first, and I think Infra and Industry Association and BBMP would have a major role in segregating and deciding where the population goes, where the concentration is. And yes.
Yeah. So what we would like to propose is a concept called porous pavements. This has basically already been implemented in Church Street in Bengaluru, and it's a concept that the pavements in the city actually absorb the water, right? So this leads to less runoff water, and we feel that it will address the problem.
Coming to unchecked urbanization, like you rightfully said, see, like we said, we want to do a scientific analysis. We can't just, what happens currently with BBMP is, or any BDA approach sites, is we just look into the proper given stakeholders and we just approve things. Problem is, like it has happened in the past, there are hidden factors that come into play and actually cause a lot of trouble like it's happening now. So use mathematical models, actual simulations to actually analyze what happens. We have organizations like ATRI that is working. We have organizations like IIC that is working specifically towards it. So we can't actually undo the problems that has been done entirely. If you get rid of Manyata Tech Park, one out of the many tech parks is gone. You can't actually do that. Only thing you can do is be mitigative. Maybe, we have the Varuna Mitra app from BBMP. We can just tell them, look, floods are coming, just take it. I mean, getting rid of Manyata Tech Park and other urban important things, encroachment has happened, but it is, what do I say, infeasible. But in the future, we can look forward, we can have proper simulation models. With the help of IIA, we can do better, is what I'm saying.
Yes, I definitely agree that certain models will help with allocation of residential areas, whatever buildings. But do you believe that mass encroachment, I think the question is addressed to all 3 major stakeholders here. Mass encroachment of lakes, which is clearly the objective of encroachment, is purpose of reallocation, the urbanization to accommodate the people, encroachment is taking place. So do you believe encroachment will continue to be one, not a major thing, I know you're looking for alternatives, but it will still be a part and parcel of your solution to incorporate and accommodate the population, right?
Looking way forward for the betterment of everybody, I think encroachment should be completely gone. The past encroachments, I don't know how much we can actually go, but future, no.
Do you believe that without encroachment this is possible?
I think yes.
Okay, all right.
Bangalore has been a victim of its own success, I would put it in a way. Like the population is a triggering factor, 9.5 million currently, and if we look at the green cover in the city, so we have 1 tree per 7 people in the city, which is an alarming situation. And like we are tackling the problem of encroachment and rapid urbanization with infrastructure coming up from the periphery, but we need to also address at the same time that there is fragmented government structure. As long as we satisfy or optimize our individual gains, if we relax the floor area ratio, if we give regulatory easing, like Bangalore Development Agency level. Like when it came up in 1970s, many of the regulations were relaxed for the city to expand. So something stringent rules and regulations and supervision has to be there from inside the government is what we strongly feel.
So for this, we do, as BBMP, we will enforce rainwater harvesting, which should be done at an every single individual level. And basically, the advantage of this is that since the built-up area has increased, there are a lot more roofs now. And if every single roof actually collects all the water, it will stop a lot of runoff of excess water, which is a major problem we were facing. And also a concept called recharge wells. Basically, recharge wells they recharge the groundwater through aquifers. And there have been case studies, like in Iran, it has actually like 60% of the flood water can be recharged to the groundwater, which, groundwater is a very good source of water for, even day-to-day activities. So we do believe that at a citizen level, we should incorporate rainwater harvesting.
BBMP are the critical actors in the process of mitigating urban floods, but let's not forget that you, the citizens group, are at the forefront. Let's not involve citizens as merely facilitators, but as regulators. So have you thought about incorporating behavioral change policies like environmental education, departing gender sensitization workshops in schools, colleges, workplaces, awareness drives? You can actually form citizen monitoring groups and watch groups to track encroachments or stormwater drains, buffer zones and lakes, and do real-time reporting and monitoring on the same. So
Most
I think
definitely.
Actually,
that is one of the most critical things. We as citizens also believe that without us, there is no functioning of the city. And I think, as a matter of fact, Bengaluru already continues to notice a lot of citizen-driven initiatives. Who occupies the parks? The citizens, right? Who encourages parks to function? Citizens, right? Who encourages all these water parks to function? Something very close to Yalanka is the Alal Sandra Lake. I think a lot of people have gone by themselves to conduct a cleanliness drive in the lake without having to, involve authorities, because they believe that their recreation times are being drawn out because of the lack of involvement. Of course, no blame here. The citizens are also equally responsible, and we are doing so to continue doing it. And BWSSB, the authorities, and BBMP here has mentioned a very critical point about rainwater harvesting and the restoration wells, I believe. Did I get that right? Correct. So I think one of the major factors of this discussion is also to decide the time period. So how long is it going to take to incorporate these incentives into the program, and do you believe there is a plan with given how slow certain developments take place, road development, transportation, traffic? Do you think there is a feasibility in matters of the crisis being...
We, the Slum Dwellers Association, want to even make sure that we are here, where we'll be learning and we'll be educating the slums who live in the place, say them what is right, what is wrong, and to stop even the concrete jungle, where population plays a major role. We'll be giving them schemes and explaining them. We'll be teaching them what is right, what is wrong again and again, until they be on a right level, where we'll be a part with another stakeholders, 4 of them, and work together collectively. That would be my suggestion and submission.
So we have a solution to make. We feel that nature. Thank you. We feel that nature-based solution would be very good, and collaborated with the technology and the industrial expertise that we can use. I would like to talk about the wetlands. Wetlands actually act as a natural sponge and absorbing the excess rainwater and slowly releasing it, reducing the surface runoff. So here, wetlands are the natural factors that we can try to focus on. But when we say that we need some technology here, because no nature-based solution can be more sustainable if we don't have technology to it, because we need to fulfill the needs of larger population. So here we have some policy recommendation. Identify and restore the encroached wetlands. So here identify lost or degraded wetlands, and anti-encroachment laws can be, here the BBMP can play a major role for formulating of the strict anti-encroachment laws. Then next would be the eco-friendly industrial buffer zone. So here we as industrial association can ensure that the industrial buffer zones are built in, like the Whitefield and the Pena, and establish the buffer green zones with native vegetation to reduce the runoff. And third would be decentralized treatment wetlands. Here use of constructed wetlands within the industrial parks to filter the runoff water before it enters the drainage system. This can be a very good solution, and this would improve the water quality and reduce the pollution load on the lakes and rivers.
So we are not here for mainly the discussion, the causes. We are also looking forward to the way forward which we. So the approach. So our approach should be WSSB board is looking forward not merely to the flood prevention but a long-term mitigation plans also. Also our approach should be to mitigate the urban flood would be the the structure should be pre, during and post. What are the action could be taken in these three phases? Like the WSSB has previously taken various during pre, during and post initiatives like rapid response teams, deployed emergency response team to test water quality, because after urban flood there is a one major concern arises of the pure water to consume. Also the pre-preparedness where we are lacking in the establish of the strategic reserve drinking water sources, including rainwater harvesting at community centers and emergency storage tank, which is also being conducted by WSSB at various levels. Also the vision WSSB would like to propose here, as all the boards are discussing about wetlands, commons and etc., to foster the flood resilient Bengaluru by reclaiming and the co-governing its urban water commons, combining decentralizing adaptive governance, nature-based solution, circular water systems, which including citizen participation. We as a board would like to recommend and highlight the very important concept of the policy formulation, which we have highlighted in the opening call also. The hardened strategy of the commons. When the land is open up for the commons, is utilized carelessly. We need to put up some rules and regulation for governing the commons also, to the which various stakeholders have discussed. That what is the pre, during and post structure I have recommended. Yes, yeah, the same. There's the same structure. Yes.
I think here the Slum Developers Association, they're clearly in most need of the problem to be solved right now. I think, guys, you can handle the time period because you are currently facing the crisis. Correct. So,
you're not looking forward to our empathy, but actionable goals. Yes, not empathy, not sympathy, not wrong.
Three major points that we can take away from here is rainwater harvesting that the BBMP has mentioned, the Spawn City plan that you guys have mentioned, and the third thing is the wetlands that you guys have mentioned.
And the governing of wetlands.
Correct.
Rainwater harvesting thing. BVSB has constructed, after studying rainwater harvesting techniques in Chennai, they have constructed a rainwater harvesting theme park in Bangalore in the name of Sir M. Vishwesvaraya. In 1.2 acres of land, which has 26 types of live rainwater harvesting models, 3 types of live sewage treatment plant models, and 5 types of interactive models in water conservation.
I think all we want to know here whether it is feasible or not.
It's already in place. Yes. It's already working, and yeah.
Can we start discussing about the action plan?
Can we just pass on the action plan?
Yes,
What we feel?
Yeah, definitely.
So we were thinking about 3 things that are short term, which will be lying from 1 year, 0 to 1 year, where we should identify and remove the key encroachments on stormwater drains and establish a real-time flood monitoring and alert system.
That
Then
we can have in collaboration with whatever you said, that is this digital urban twin.
Twin.
We can have it with real-time monitoring of the flooding areas.
flooding and alert system, wherein when it comes to blue or green or red zone or orange zone, we should alert them. Restrict them as actually Bangalore did previously.
So I would like to suggest that there's already an app called Megha Sandesha,
Yes.
which is working on that. I think people need to be more aware of the digital tools that are in place. Digital literacy drives should be conducted for the same.
So we have to conduct public awareness campaigns on water disposal, then even rainwater harvesting. This would be the short-term plan, what we are expecting. The medium term will be 1 to 3 years, where we have to develop and integrate the management system from BPMP and the water sewage board as well. Then we should improve urban planning laws to prevent new encroachments. That would be coming under the jurisdiction of Infra Industry Association.
I think, okay.
In the closing remarks, if like just a suggestion, if you want to decide how you want to finally present the final action plan, right? So take those 3 minutes, and in your closing remarks, remember each team has 2 minutes, and you have to work as like a collaborative group. So together you have 10 minutes to present, 3 minutes to prepare, and present the final policy action plan given whatever you've discussed in the last 40 minutes. So we can go the mics off. Yeah, friends, time's up. Okay, so we'll give 2 minutes to each team to make their closing remarks. So we'll start with the water sewage board.
Groundwater tables and fills lakes in drought-prone regions like Kolar and Chikkabalpur, indirectly easing floods by managing surplus water, sustainability, and urban limits. So the way forward here from the our board, BWSSB aims to replicate similar integrated project in other flood-prone catchment, ensuring treated wastewater is effectively reused and recharge aquifers and lake beyond Bengaluru. Because after urban flood, there is a urgent need for the pure water. Also, such intervention directly contribute to flood resilience, groundwater rejuvenation, and long-term environmental sustainability, clearly demonstrating holistic urban governance. Also, there is need to press on the urban water commons, which is lacking behind these days because of lack of governance structures. Thank you.
So from the Infrastructure Industry Association, we take into consideration primarily the Slum Dwellers Association, which are at forefront of the risk, and we would work effortlessly with the municipal corporation to not only create a digital twin for the city, which would create flood simulations and evacuate slum dwellers within before the situation aggravates, and furthermore, when it comes to building sustainable housing, like providing basic amenities, so for that we can as well identify zones particularly designated to relocate the slum population, and during the dry seasons or non-monsoon seasons, those centers can be used as community centers as well to promote and foster community activities. Addressing the issue of wetlands, so again GIS mapping would assist to identify wetlands, and which acts as natural sponges. That is it. Yeah, that is it from our end.
As the BBMP, we would like to conclude by firstly telling about all our policies in brief. Firstly, we're improving existing drain network with a lot of scientific model simulations, and also we really like the idea of digital twins. We'll collaboratively work with them to come across. We also are actively working towards encroachments, like you all rightly pointed out, but we've also convinced you as to how some are actually great economic hubs and you can't just do away with it. Further encroachments won't happen. You can take it from us. Revival of lakes, desilting, all that was covered. Thirdly, rainwater harvesting. Well, all of us spoke about it. One thing as BBMP we would like to request is make sure that this actually happens, right? We don't want things to just stay in paper like they always usually do. So we need the help of the smart citizens group so as to make sure that this actually comes into play, and then rainwater harvesting can actually happen. And like they rightfully said, we can have, we have 30 parks. Why can't we just make rainwater harvesting possible in any of those? That will greatly impact us. So we appreciate that suggestions right there. Innovative green infrastructure measures came from them, all of us coming from nature-based solutions. While this is great on paper, coming with this only can happen in the future as we, make more developments. Infrastructure Industry Association will have to help with us. Spun Cities is a great thing that has worked. Evidently, it has worked. I think it will work if we can collaboratively work towards it. That's what. And lastly, plan for the city expansion, greatly pointed out by you guys. This is the biggest problem. One problem to state for this is urbanization, unchecked urbanization. So future, we'll make sure that this doesn't happen. That's what I would like to say. My partner will continue.
Yeah, so as BBMP, as my partner rightly summarized almost all of the problems, so basically we'll ensure that all of this will happen, and as the government, we really appreciate the views of all our stakeholders, and we would like to conclude.
Before I say anything, from the citizens group side, we promise to cooperate. we are on the receiving end of all these problems, and without cooperation, nothing is going to work. So citizens group promises to cooperate, and we will work towards the benefit. Secondly, I laud each of the stakeholders involved here to come up with actually practicable solutions. And given the paucity of time, we have managed to discuss a lot of things in 40 minutes. And addressing one by one, we have addressed rehabilitation. We have addressed how to, we have addressed wetlands and how to mitigate risk factors. And the second thing is addressing rainwater harvesting as one of our major contributing solutions to convert parks into wetlands. I think a very valid point that you mentioned was how there is how do I say it? It's one of the casualties, like the methane gas emissions, right? I think in order to address that, some of you have rightly pointed out certain scientific models that will help in developing alternative methods. I think most definitely one group meeting is not enough to come up with the action plan, and this definitely calls for a second one. So as of now, I think the first immediate evacuation plan should be incorporated and followed through. And
thank you.
Honorable stakeholders, esteemed leaders, and dear citizens, as we conclude to this critical discussion on urban flooding, in Bengaluru, we must remind ourselves this is not just a crisis of waterlogged streets, encroachments, and failing drainage systems. It is about human lives, livelihood, and dignity. Today, as we laid out a comprehensive roadmap that calls immediate, medium-term, and long-term interventions, I would like to put it in a collective recommendation that each stakeholder group can help in, as per their jurisdiction, they can help in mitigating the challenges. BBMP must enforce zoning laws and remove encroachments while investigating in flood-resilient infrastructure. BWSSB, that is a water sewage board, can separate sewage from storm waters and implement large-scale rainwater harvesting and groundwater recharge initiatives. The citizens group can act as vigilant watchdogs, ensuring policy implementation and advocacy for eco-friendly urban planning practices. The infrastructure industry must adopt sustainable construction methods, integrating permeable surfaces and green technology. And the Slum Dwellers Association can help in having a say in the government discussions, as well as ensuring that no one is left behind in such flood mitigation efforts. We promise that we'll be there, whatever the policies are there, whatever the government suggestions are there, we give our 100% that we'll comply, we won't revolt to it. Whatever the policies are, we'll abide by them. And also, this is not just about policies and governance, it is about people. We must not forget that people are at stake over here. Over 9 lakh people in Bangalore slums bear the worst brunt of these floods, as they lose their homes, their incomes, and sometimes even their lives. As Mahatma Gandhi once said, the true measure of any society can be measured or found in how it treats its most vulnerable members. We cannot allow urban flooding to be an annual event. We must act now with urgency, with accountability, and with compassion. Let's not wait for another crisis and that will remind us our responsibility. Together, let us just build Bangalore that is resilient, sustainable, and just for every citizen, from the tech corridors to the slum settlements. And it's just the discussion time is anyways over. We feel that let's act upon what we did discussed today.
Thank you so much, teams. Can we just have a big round of applause? So we'll give some time to the jury because this has been a really engaging discussion. One amazing thing, so I had my colleague Saurabh here who was taking notes, really quick notes of whatever everybody was saying. We also have the live YouTube recording, so you can go back and see how you performed. We are also thinking, that everything that's been put together, ideally we'd make it into a document and possibly actually send it to the Bangalore government. So. And they must be surprised. In 40 minutes, these kids came up with this great recommendations. But let's see.
Give a roadmap to them, we can just bring to their notice that we are acknowledging
Okay, thank you. So we'll give 2 minutes to the jury so that they can come up with the winners.
So congratulations to everyone. You had wonderful round of discussions. We really enjoyed being here. And we just wanted to share some of the things you all had missed. And I think we'll go, a couple of points from each of us. First point I thought you didn't address were the issue of hazardous and e-wastes right now, which is also connected to the digital twinning project you're saying, because that's going to increase hazardous and e-waste in the city, right? So how is that going to affect urban flooding? Is there a link? You should be able to explore that. Another point I thought you didn't really think about is, you did talk about siltation, but this keeps happening all the time. Okay, and where does this siltation happen? It doesn't happen on the lake bed that you're seeing. You are just looking at how the water levels drop in the lake bed. But the siltation is actually in the Raja Kaluways that the lakes are connected, right? So what are the solutions that you would think of? This actually would cut urban flooding by more than 60%. Okay, that's where the sponge concept city concept that you spoke about will really take shape. So that's something that you missed. I thought I'd highlight it for your attention. Over to Samar.
It was, can you hear me? It really felt like you guys were working on the city. Incredible research and passion. So all the best in the future. I would like to say that, the architect who built Church Street also built a waterway, K100. That is the best practice in Nala design, in Raj Kalwe design, right? And we have to cut down on the urbanization, and that has to be, like if you are saying nature-inspired, nature-based solutions, if nature was to design this city, you would first stop what is not conducive for the city's growth. So you have to know how to prioritize some things while everything is so important. I also like that you refer to other cities and what is working, and because nature would also replicate strategies that have worked. So that was really interesting. Yeah, and the bit about C&D waste and hazardous waste and a whole lot of that can be done. But also it is very hard to implement anything in an existing city which is already overcrowded. Even that K100 Nala took a lot of beating. So it is interesting to see the peri-urban areas also, and to address in the future, like the peripheral ring road, which is a 74-kilometer, 100-meter wide road, which is coming to connect the north to the south in 6 major lakes. 30,000 trees are going to be affected. So also have that kind of speculative future thing. Look at what Outer Ring Road did. If you see 30 years of Google Earth simulation, you will see that with the road coming in and the bore wells and the wells have increased. The green cover is gone, the lakes are gone, right? So we cannot repeat that. We cannot deal with obesity by loosening the belt, So the road is a very, like infrastructure-wise, the ring roads and all those big major infrastructure projects are important, and that is where people's governance also can come in terms of objection and the rights that you have, because lakes cannot be encroached. Few days back, Supreme Court has just come up with a ruling that you cannot have a road enter a forest, a designated forest area, right? So there is enough on the rights of the people, and so while there is awareness, what was missing for me is that, and maybe some of you are not from Bangalore also, but that single-pointedness in terms of this is one problem that we can all now work towards, which will solve the issues. Also including decentralization deeply, right? So yeah, I think I will just tell ma'am to...
I think both of them have covered most of the points, but from me, there are two things that stood out was, we spoke about technology, but how many of you all, there's so many apps that have come out. Even I don't know how to use the apps. What is the awareness program that's being conducted? Because often I engage with my garbage man. He comes, they strictly tell, put it in green bag, red bag, blue bag, everything. But when I see him taking everything, he dumps into one tempo. So I asked him, why are you troubling us? He's saying, madam, nam kelsa illinda ikkade, allinda aake haaktivi. Now, How are each of you addressing this? How should we address? Teach them, show them, participate. The other thing I remember sometime back, the government of Karnataka did bring out apps, but I don't think they're working at all. So I always say, why are we going on inventing things? Why can't we reinvent and use the wheel? Just reinvent. But I think where we are lacking is awareness programs, social accountability. We don't have any indicators or measurement to make citizens, government, corporate, academics, NGOs, everybody accountable as stakeholders. There are good tools, but how many of us use it? I think that's very important, because I love the idea about the stakeholders and all, but as many of you all said, a lot of it is on paper. When will it get into action? But anyway, it was very interesting, and congratulations to each one of you all. Thank you.
I would also like to say that I was really missing BDA as a stakeholder here at this discussion, because when I started doing water-related work 10 years back, we realized that the lakes came under the revenue department, right? Then it went to BDA. BDA sucked it dry and made buildings, right? Then they gave it, then the government set up a parastatal body called Lake Development Authority. Then they diluted it, and it still has an office. So they, they ask us to go there. So there are these, every lake will have its own issue. Decentralization, do look up biomimicry and nature-inspired ways of strategizing for solutions. So you can have a solid approach that can bring multiple points of view to address something concrete.
I know you guys are eagerly waiting for the results. So before we move on to that, yeah. Before we move on to that, CCS would like to extend our token of love to the judges here. And first of all, Dr. Harini, Ms. Simar Kohli, and Dr. Annapurna. We thank all of you for making the effort and sharing your feedback with them. Thank you.
Okay, so the results are in. Without taking more time, we're going to announce the first runner-up team. Any guesses? Okay, so the first runner-up is Team BBMP. And the winning team is, can we get a drum roll? The winning team is the Infrastructure Industry Association. And the best speaker, any guesses? And the best speaker is, sorry, I can't pronounce your name. Kata Vishtagod. You'll have to teach me how to pronounce your name. So we have goodies for all of the teams, as promised. We have the goodies for all of the finalists. And I will be in touch with the winning teams about the prize money, as promised. The certificates of participation as well as the winning certificates will be emailed to you. So we are not doing printed certificates, okay? So we're just going sustainable there. Thank you. Thank you to our jury, all the teams. I know some of the R's are working hard for us. Thank you so much.